or miscarriage, it's already in the uterus. So is another thing. So for the ectopic pregnancy, it usually happens in the tubes. And if the Grandma Karoma, and if the uterus has been, if the embryo is fertilized in the tube, because after some time, my boss. So yeah, so ectopic pregnancy is just stricture disease of the tubes and all of those things. The pregnancy is not where it's supposed to be. It's either in the ovaries or in the tube or outside the womb. Then it will lead to ectopic pregnancy. Baby Soft, do you want to say something before I go on? Baby Soft Life, do you want to say something?
Yes. So I just wanted to say, for the sake of Dukia, so what I wanted to say was, that resource thing, that resource negative thing. In my own case, that was my husband, that was the first child, that was the first baby. But I don't 100% know, but I think we had different blood groups or something that was also different to the baby. So what they sort of said to me was, they had to give me that antibody so that my body does not reject subsequent pregnancies. Does that make sense? So you probably would know what they found, but I don't know. I just thought it was a blood group difference.
Yeah, it's
So maybe if they missed it for the person Dukia is talking about and they didn't give her the antibody, but she's already had 3.
Yeah, but for this person, the person has changed a partner.
Oh, I see. Because what I'm saying is, so it can happen even if you don't change a partner. Is that correct?
No, it shouldn't.
But I didn't change a partner.
So was it your first?
That was me. Getting married, the first person that I'm with.
In this case, why I'm saying maybe if she's changed a partner in the sense that she didn't know about her factor.
Oh, I see.
But if for your
own case,
for your own, after the first baby, they know there is disparity.
Yes, in the blood clinical blood groups.
In the resource factor. So they will give that RhoGAM. It should be given within 72 hours of.
I see. So they did an antibody injection thing.
Yeah. So they will do that. So they will give that RhoGAM-D. We call it RhoGAM-D or RhoGAM. So they will have done it. I think it's about 42,000 naira now in Nigeria or thereabout, but it's less than 100,000. But they have it. Nigeria knows it. They really.
I sent you a message.
Yeah, I've seen it, Sister Dukia. Yeah, that is
that also for me, because with me that was even my first ever pregnancy. Do you get it?
Yes.
So I don't know in the UK how they came about that, but they just said, "Oh, your blood group." Oh yeah, they did say something about the uniqueness of my blood group, and they were even asking me and begging me that I'm one of those ones they look for to donate blood because it's universal. I'm a universal donor.
Oh, that's good. Yeah.
I'm a universal donor. So they did say that. I know they said that, but there was also something about, the blood, whether AAS or whatever it was. And then they did say, oh, they needed to give me that injection. So that subsequent pregnancies are not attacked.
Yeah. So it's called RhoGAM or anti-D.
Okay.
So that's why I'm talking about, this is why I talk about giving our girls proper health education or sexual health education, in the sense that knowing if they ever get pregnant, so as to know what to do when they now get married, what needs to do, because for the first pregnancy is always a factor, especially if you do not know the resource factor of the partner or the person that gave the first pregnancy. You understand? But for a woman who is having this resource factor, just to be on the safe side, generally they will give the injection within 72 hours of a live birth, miscarriage, or an abortion. They will give it so that subsequent pregnancy, the body do not reject the baby or the fetus. No, they won't. They won't just. No, they won't just give it.
It was just newly married, first pregnancy. Abere was so painful. I'll never forget it in my life.
Yeah. So they giving that injection to prevent abortion in subsequent pregnancy or miscarriage.
Okay.
Because, so
Okay, and before I get down, I'm sorry, sis, because I'm still at work. I'm just chilling. But there's one more thing I wanted you to speak to for Dukia's question. Did you want to? Because I know someone who had about a lot of miscarriages. That's because cervix. So when she's about maybe 10 weeks or something, the baby just pops out. Do you get what? So they had to sew her cervix at 12 weeks or something like that to keep the baby in.
Yeah, so we call that
can be a problem too.
Yeah, we call that incompetent cervix, but that usually doesn't occur. Generally, that doesn't usually occur before 13 weeks, because that baby must be resting.
Yeah, you're right.
Yeah. So
you're right. They didn't sew this person up every time. To she must have had about 5 or so. Like the baby just came out. They did not sew her up till she was about 12 or 13 weeks, like you're saying.
Yeah. So it's called cervical cyclage, and also so different factors causing miscarriage and all those things. So the person really needs to speak to their health provider and see what can be done. But for a woman that age, and they might look at the man as well, has he had previous kids? What is the motility and the viability of their sperm? Because sometimes for a woman to carry a successful pregnancy, sometimes it depends on the strength of the sperm, to be honest. So it could cause, but that could be, Moji, I'm a registered midwife as well. So that could be a factor, but generally for the motility or viability of the sperm, sometimes when it has peaked, to fertilize ovum, and if it is healthy, generally it doesn't really have effects. But for the number one cause is the abnormality of the fertilized ovum or the embryo, let me put it, of the embryo. And so they need to carry out tests. One of the tests is to look at their thyroid. Yeah, I'm just trying to. Yeah, they need to check the person's. Fumilola, please, can you rewrite that? I'm trying to read what you wrote. I'm not getting it. So yeah, they need to go for tests. If they are overweight, if the weight is an issue, they can start the person on some lifestyle modification. If they are having issue with their thyroid, they need to see a specialist, an endocrinologist. And if the person lives here in the UK, they are actually very good. They can be on treatment for it. And believe me, most times subsequent pregnancy will stay, because they will really, really manage it. UK, in that one, they're very good, especially if you've had first miscarriage and you really want to have a child, they will manage you very well. So they need, for women, especially we Black women, we need to see the endocrinologist for them to see. So the person can go to their GP if they live here in the UK. If they're in Nigeria, they can still go see a doctor. They should ask for thyroid function tests. Usually, if every other thing if they've ticked the boxes for every other thing, they should check the thyroid function test, and it could be a factor to cause, so she can go to the GP and request for thyroid function test. Just ask for all the tests. Is vitamin D, they can check their vitamins level, calcium level. All these things are, the phosphate as well. It's a major factor, so they should request for full body work. And honestly, if you're in the UK, especially from our Dudu, UK have free health, but because of what is going on at the moment, if you can go on a private health care, every month where you're paying is not much, at least you will be seen quickly, tests will be carried out, and you can be referred to a specialist in the teaching hospital. So Sister Duke, are you happy with my very question? Oh yeah, Lola, Fumilola, yeah, it will affect, unfortunately. That's why I said we need to give proper health education, especially for our girls, getting rid of that first pregnancy or having that first pregnancy or that first baby, you need to carry out all these tests. That's why at antenatal, they look at all these things, so as to know what happens in subsequent pregnancy, because it's not the first baby that is the issue. It is the first subsequent pregnancy, and if you've done the test within few days, they will let you know, and they would have prepared the woman that there is an injection we will give you. It costs so amount, so you can prepare. The Rogam, it used to be very cheap, but now I think it's about 40-something thousand. You can tell me if it's gone more than that, but I know it's still less than 100,000. It is expensive if you look at the other factors of hospital bill, but it is something that people need to talk about. Yeah, what was the other question that someone asked? So yeah, for the blood pressure, you need to know what your baseline is. Always know your baseline. It will help to determine how you can be managed, because normal, for some people, if your blood pressure is less than 140 systolic, the top one is a systolic and the bottom one is a diastolic. So you're looking at it, your diastolic should not get to 100. That's the bottom one. It's usually an indication of something really wrong. So it shouldn't be reading over 100, even if your systolic is low. But if your diastolic, so it's still an indication of something going on with the heart. Easy, it's now 100K. Wow, that is something. So in your tofe bimo add to 100K more. Whoa, abere. Wow, that is really. It's used to, when I was in Nigeria, it was like about 11,000. But that's.
Yóò bá nídìí pé ń wọ ọmọ ẹ pàdé yín mọ ò, gbogbo àwọn owó lọ́tún lósì.
Abẹ́rẹ́ nǹkan ẹ pàdé mọ́ o.
Ẹ pàdé mọ́ o. Òun la rí fá ń tọrọ owó o. Ìyàwó mi bímọ kiri báyìí.
Mommy Ashabi, in the UK it's free. You don't pay for it. I'm talking about Nigeria. 47,000 pounds. Okay. Major health.
Èèyàn mélòó ló ní ẹni tó fẹ́ fi sanwó abẹ́rẹ́ nìkan nílùú yìí?
Nílùú irọ́ náírà ni, but wọ́n ní ó ti wọ 100K ní Ireland, so yeah. So tí ẹ bá nídìí kíní ẹ pàdé yín mọ́. So those are things we need to look into. Yeah, but for the blood pressure, yeah, know your baseline. Baseline is, even our blood pressure machine, they are cheap now. You can even buy them on you can buy them on Amazon, on all those things. So you can check it, because sometimes reading hospital only go high. There is something they call white coat scare. And when I've been conscious. So if you can check it at home, know what your baseline is. So it's Say hello, big mommy.
Hi, darling.
Say hello. So yeah. Amen. Am I praying that you're saying amen? Preterm babies. Oh, it's still a lot of factors that could cause preterm babies. It's a lot of factors, and the body just trying to get the baby out. A lot of factors can cause preterm baby, to be honest, but they try. As one of the things we've talked about is incompetent cervix, multiple pregnancy. Multiple pregnancy. I'm trying to use the right word. 2 or more baby. There is a proper term for it. 2 or more baby, only baby better, or might cause preterm babies, something going on in the body, stress, preeclampsia, the uterus not the way it should be. So many factors could be a cause. They try as much as possible to prevent it, especially if the lungs have not developed. But unfortunately, sometimes there is multiple gestation. Thank you. But there is sometimes there's nothing anybody can do about it. So but there is sometimes there's nothing anybody can do about it. So
ṣé ẹni tó ti bímọ rí ó lè ṣe IVF?
yeah,
Or is this strictly for those that, like someone that wants to have multiple babies, can they do IVF?
they can, but to be honest, for good success rates, generally Nigeria is very good with the IVF.
Okay.
In UK,
Can select gender too.
yeah, they can select the gender too. And UK, Guy and St. Thomas in London, they are very good. And once you buy now, pay later, you see, I actually did check for some.
Okay, Klana Sanwo.
So you can speak to the to Guys and St. Thomas in London. They are really good as well. But I know Nigeria have very, very high success rates with IVF to man lead to multiple babies, and they can do gender selection. But but the risk of IVF that people need to hair by Debbie, it could. That's why sometimes for people that have low sperm counts and low morphology, they could ask them to. The option of IVF is good for people with low sperm counts, to be honest. So you can select but low sperm counts is different from the low morphology. So we are looking at two things now. Having low sperm count does not mean you cannot impregnate a woman. So it's two things we are looking at. So, but it's just that if you don't, the emoji, which waiting period is it in UK? Long, yeah, but if you go private and you can do the color buy now pay later, you can speak to them. They understand and they are looking at these things, you know. Yeah, so it could be a factor, but preterm babies, it depends on the body, it depends on the woman. Stress as well, the state of the cervix, the state of the uterus, and you know. Low motility is just. Are you asking if it can cause abnormality it can cause abnormal child or deformed child? It's probably, but honestly, I'm not sure, because low motility, you're just saying slow to move. You know, it doesn't mean it cannot fertilize. It's just saying it's not moving at the speed it should. So yeah.
Yeah, what that person is asking, let me try and see if it's similar to this person, Timo Shesoreton. So her bloods were not increasing. I think they said it has to be about 1,800. So when she did the first blood work, it was about 700 and something. And then she went back a week after, and then it increased to about 800 and something. Is that the same thing? See any trial artist on in the comment section?
No. The blood you're talking about, the person is already pregnant, and that one is to check, is the HCG level they are checking.
HCG level, yes.
Yeah, that is to determine if the pregnancy is still there. So the HCG level, the blood will tell you, the amount will tell you if Onyunyeshi Wambe. So they will that's why sometimes they will just say there's nothing we can do. But if it's still high, they can just put the person on bed rest and like, okay, let's see and do other finding. But if it is low and it keeps decreasing, it means the pregnancy is not viable. There's nothing.
It was actually it was increasing, but on a very slow pace.
Yeah, because it's for the first few weeks, it should really be very high. So if it is increasing at slow pace, that means that pregnancy is not viable. So they just wait and just see. Yeah, MOJ, I think you can check Guys out because they have a private unit that they do this, so speak to them, because waiting period here in the UK, especially if you've had a child before, generally they won't do anything. That is the truth. If you've had a child before and you want to go on NHS with IVF, they will not prioritize you. They won't prioritize you. So you have to be a certain age, never have a child, then they might prioritize you. But if you've had a child before and you're still, so there is a lot of factor NHS we look at. So if you've never had a child before, they might prioritize you. But if you've had a child before, honestly, you'll be at the back burner. And so if you can afford it, you can check guys on St. Thomas in London. They can take you on and you can do. Yeah, because in US you're paying, but in UK is NHS is free in quotes. Of course, we're paying tax and NI, but it's free in quotes. So let your GP look into that now. They should refer you to fertility clinic and do something about it. So, but if you really can afford it, or if you can go to Nigeria, please, is cheap in Nigeria. And there are very good clinics in Nigeria that are really doing it. But if for whatever reason, if you cannot travel and all those things, look at guys. But if you can travel, if you and your husband or partner can travel to Nigeria, not going up to 5,000. Write to them, write to the units, write to their patient advice lesson, write to your GP, tell them this is your concern and all those things, because sometimes I'm a see backbone, so write your letter, raise your concern and see how it go from there, raise a complaint, so you can be looking at both or the three. If you can go to Nigeria with your husband and go to some of this clinic, it's another option to look into. But if you're not able to travel and you just want to utilize the NHS, write to your GP, keep bothering them, write to the patient advice lesson services of the unit, and tell them your concern, tell them it's giving you anxiety, it's giving you this. Anxiety and all those things. Tell them how and why, so they will speak with you, So, yeah. Yeah, Niger, the thing is with this situation, with this particular situation, with the women health in Niger, it's really not bad. Treatment of fibroids, treatment of IVF is really not bad in Nigeria. But another thing we should be mindful of I'm not going to speak about it because there are people that are trying to have IVF here, but it's just looking at overstimulation of the ovary is another thing, So look at all these things, but yeah. Ever pick mommy, I shall be up. So yeah, there is.
Yeah. A request agbe.
I request you. Yeah, so yeah, MOJ, read what Baby Soft wrote as well. So check, don't keep quiet. Don't wait for them to contact you, please. You are the one that need it. You are the one that need to contact them, Yeah, Tosmary, nothing is 100% anywhere, but we are looking at the success rate, We're looking at the success rate. We are not looking at 100%. We're looking at the better option for the person that needs it. So, yeah. Mommy, I shall be a first sorrow.
Ẹ káàsán gbogbo ilé. Ẹ káàsán o, ṣé ń gbọ́ mi?
I'm going. Ẹ káàsán.
Ẹ pẹ̀lẹ́ mà, ẹ kú iṣẹ́ takuntakun, mo kí everybody o. Mo kàn fẹ́ sọ díẹ̀ nípa experience mi nípa ọ̀rọ̀ ó ṣe IVF kò ṣe IVF fún àwọn èèyàn tí wọ́n bá ń wojú Ọlọ́run fún irú nǹkan bẹ́ẹ̀ yẹn. Ṣé rí èmi, Ọlọ́run ti jẹ́ kí n dàgbà díẹ̀. But mi mọ̀ bóyá mo ti sọ̀rọ̀ rí nípa experience mi nípa bí mo ṣe like láti follow platform yìí nítorí Ọmọ́wùnmí, because èmi náà ti fẹ́ ọkọ at my younger age tí ọkọ ti kú tí mo dẹ̀ bímọ síbẹ̀. So it took me another 10 good years kí n tó rí màá rí. Ṣé ń gbọ́ mi?
pẹ̀lú
Ṣùgbọ́n
Hello?
yín máa continue, yeah, à ń gbọ́ yín, à ń gbọ́ yín.
So ó take me ní another 10 years kí n tó remarry. So ṣe mọ̀ ìgbà tí mo dẹ̀ remarry ṣe mọ̀ àmà ẹni tó lù ẹ fẹ́ èèyàn tó wà kẹrin gbogbo ẹ̀. So ṣáà wò pé kí n bímọ fún onítọ̀hún. Mo ṣe mi tí mo ti bímọ méjì rí. Mo ṣe kò sí oyún. Mo wá lọ ṣe IVF. Mo ṣáà lọ ṣe IVF. Mo lọ ṣe bí ọ̀nà mẹ́ta. Tí bá ti ṣe báyìí kò ní work, tí bá ti ṣe báyìí kò ní work. Ìgbà tó máa di ẹlẹ́ẹ̀kẹrin èèyàn kan ló kàn júwe ibẹ̀ yẹn fún mi, màá yìí sọ ibẹ̀ náà later. So ìgbà tí mo débẹ̀ wọ́n ṣàkọ́kọ́ ṣe scan everything, wọ́n ṣe gbogbo ẹ̀ fún mi. Ìgbà tí ẹni yẹn máa ṣe scan yẹn fún mi, ó ní nǹkan kan wà nínú womb mi, ó ní mo fi ń sọ̀rọ̀ polyps nígbà yẹn, mi mọ̀ bóyá ẹ rántí tí mo ṣáà fi ń tẹnumọ́ pé ká sọ nípa polyps. So ó ẹni tó máa ṣe IVF yẹn fún mi ó ṣàwá ní àwọn kọ́ làwọn ń ṣe, àwọn máa refer mi lọ bá gynae tó máa ṣe fún mi ní VI. Mo ṣáà lọ síbẹ̀. Ìgbà tí máa débẹ̀ tí àwọn yẹn náà máa test mi, ó ṣàwá rí pé mo ní polyps. Mo ní kí ló ń jẹ́ polyps. Mo ṣáà ti rí pé tí bá ti kó tó di pé mo lọ fún gbogbo test yẹn, tí bá ti ní nǹkan pẹ̀lú ọkọ mi, màá ṣáà máa rí pé láàrin bóyá ní nǹkan òun tó bá máa ṣe díẹ̀ máa kàn rí blood, máa kàn rẹ̀ jẹ̀. So wọ́n ní kinní yẹn ni ó fà pé polyps yẹn òun ló fà tí ó fi ń ṣe mí bẹ́ẹ̀ pé in fact àwọn máa ṣe fún mi but àwọn máa sọ fún mi bóyá ó ti wà cancerous àbí kò wà cancerous. In fact ẹ wo gbogbo yẹn ọ̀rọ̀ ẹ̀gbẹ́ kan ni. Ìgbà tí mo ṣáà máa ṣe kinní yẹn wọ́n ṣáà fún mi ní 1 month ni màá fi wá gbọ́ result. Gbogbo ìgbà yẹn ẹ̀rù tiẹ̀ ti ń bà mí pé ṣé mo ti fẹ́ kú ní ìbáyìí nǹkan kan bẹ́ẹ̀ yẹn, but alhamdulillah ìgbà tí result máa jáde kò wà cancerous. Wọ́n ṣáà ṣe operation yẹn fún mi. In fact kò ń ṣe pé bóyá wọ́n ti ẹ̀ la nǹkan kan lára mi, but mọ́mí mi yọ ẹ ti máa mọ bó ṣe procedure yẹn bó ṣe máa lọ. So ìgbà tí mo ṣàwá ṣe gbogbo yẹn tán, ìgbà yẹn wọ́n sọ fún mi pé womb mi kọ́ pé ó ti clear, wípé because tí mi ì bá ṣe nǹkan tí mo ṣe yẹn, mo bá máa ṣe IVF 20 times oyún ò lè dúró, pé because kinní yẹn ó dàbí ẹ̀gún ni tó yẹ pé anything tó bá ń wọnú ẹ̀ báyìí a máa gún, kò ní jẹ́ kí oyún lè dúró. So ẹ̀yìn ìgbà yẹn ni mo ṣẹ̀ṣẹ̀ wá lọ ṣe IVF tí mo dẹ̀ lọ ṣe ń gbà yẹn I was 43 years old nígbà yẹn. So àwọn ọmọ mo ṣáà lọ ṣe IVF ó dẹ̀ wà successful. In fact ẹyọ kan mo béèrè, ìbejì ló wà. Àwọn ọmọ náà ti pé 9 years báyìí sìn. Hello. So àwọn ọmọ náà ti pé 9 years báyìí sìn. So nǹkan tí mo kàn fẹ́ sọ lórí ẹ̀ ni pé ṣe rí gbogbo àwọn ibi tí wọ́n bá ti ń lọ ṣe nǹkan tí wọ́n bá mọ nǹkan tó ń ṣe, èèyàn kàn máa sanwó dànù ni. So ibi tí mo ti lọ ṣe yẹn ṣe mọ̀ pé tí ò bá ń ṣe pé wọ́n refer mi pé kí n lọ sí ọ̀dọ̀ gynae pé àwọn orí kankan ní womb mi kankan bẹ́ẹ̀, ṣe mọ̀ pé màá tún ṣe, màá sọ pé kò work. So mo dey expect pé irú nǹkan bẹ́ẹ̀ yẹn gan ó ti máa ṣẹlẹ̀ sí many people tó máa sọ pé àwọn ti ṣe IVF níye báyìí, àwọn ti ṣe nígbà báyìí tó yẹ pé kò work. So ó yẹ kíyàn really mọ̀ pé ibi téèyàn ti fẹ́ lọ ṣe, láti má máa sanwó nù, láti má máa sọ pé òun ń ṣe kinní kan, so that kíyàn mọ nǹkan tíyàn ń dáwó lé lórí àti the right place láti lọ. Ṣọ́rọ̀ mi yé yín? Ìyẹn ni mo ní kí n sọ wípé kíyàn consider irú àwọn nǹkan bẹ́ẹ̀ yẹn kó tó di pé yàn gbé ìgbésẹ̀. So mi ò fẹ́ wá polówó ibi tí mo ti ṣe, but nǹkan tí mo kàn mọ̀ ni pé ẹni tó ṣe fún mi, Ọlọ́run gba ọwọ́ ẹni yìí, Ọlọ́run gba ọwọ́ kílíníìkì yìí ṣiṣẹ́. Kílíníìkì náà wà ní Dolphin Estate phase 2. Mi mọ èèyàn tó bá mọ area abẹ yẹn á mọ nǹkan tí mò ń sọ. So mo kàn fẹ́ mú idea wá pé anybody tó bá fẹ́ ṣe kọ́ wo ibi táwọn máa ti lọ ṣe, so that kò ní jẹ́ pé wọ́n máa gbowó lọ́wọ́ wọn, wọ́n á máa wò ó pé àbí èèyàn kan ló ń ṣe àwọn, àbí kinní kan igbá kan àwo kan. Ìyẹn ni mo ní kí n sọ̀rọ̀ lé lórí. So anybody tó bá ní interest níbẹ̀ tó fẹ́ sọ pé okay bóyá òun fẹ́ ṣe, wípé bóyá ibi tí mo ti lọ wọ́n á ṣàlàyé everything fún yín kò ṣe pé ẹ kàn máa wọlé wọ́n á kàn ní kẹ́ sanwó gbùrùgbùrù iye kan báyìí ló jẹ́ ẹ sanwó gbogbo yẹn náà lèmi náà ti go through kó tó di pé Ọlọ́run wá gbàdúrà mi so ìyẹn ni mo ní kí n sọ o ẹ ṣé everybody.
Ẹ ṣé ma, thanks for sharing o, ẹ ṣé.
Eshegon, that is a very important information, to be honest. And yeah, they need to check. Okay, we've done the IVF because sometimes the success of the IVF depends on the woman's body and the background and things that is happening. So, but yeah. It's very important, Eshegon. And also, Tosmarin, yeah, you said, you're very right. Is Agbanot, go to the right place, having the right information. And aside the financial aspect, the emotional aspect as well, the physical pain, because people just think Molosha IVF and is the answer. It's the injections. It is painful. That is the truth. It's not to scare anyone because as Obirin, when we need something, we go through it, but there is emotional aspect that needs to be dealt with as well. The psychological aspects, all those things needs to be dealt with. So we need to go to proper specialists that actually have the interest of the woman. Of course, you're paying your money, but we need to go to where actually have the interest of the woman at heart, and before we embark on this journey. Mommy Gypsy babes, you're very, very right, and this goes for our girls most especially. Honestly, why am I stressing on our girls is because in all this, we women, we are at the receiving end. We are the one at the receiving end. Obìnrin lóyún, obìnrin ni, kò lóyún, obìnrin ni, only miscarriage, obìnrin ni, oyún, all these things, obìnrin ni. So we need to let our girls, we need to do all these blood tests. It's not routinely done here in the UK, except if you're like 18 and you go to your GP and you want to know. So before the first pregnancy, we need to know, especially that resource factor, so that for whatever reason, whatever happens to first pregnancy, they will tell you what you need to do before subsequent pregnancy so that could not affect, And why is it common? Why we are having this ROGAM issue in Nigeria is because, to be honest, most time, because we don't know, secondary school, university, oti sáré lóyún, àwọn òbí mi ò gbọ́dọ̀ mọ̀, ó sáré lọ sí one roadside clinic, wọ́n ti bẹ̀ flush here, in quotes, and then ma wọlé ọkọ, a máa ní miscarriage, a máa ní kéde, a ní àwọn kan ló ń yọ oyún jẹ. No, it could just be your resource factor that is just getting rid of it. And sometimes it might not be the resource factor, it can be the abnormality of the embryo. It could be your own body, it could be your immune system attacking you. Our immune system, autoimmune disease is like soldiers just not knowing kid soldier tó yẹ kó lọ dojúkọ enemies, but kó wá dojúkọ ará ìta. There was a situation like that in the Bible. Táwọn sọ́jà yẹn wọ́n dojúkọra wọn. That is what autoimmune disease is. Your body fighting against itself, So yeah. Ṣé lecture yóò wá ti pọ̀ jù báyìí? Ṣé kí ènìyàn burú bẹ̀rẹ̀ sí ní play for us so that àníwá oversaturated?
And then enjoy lecture you. No, people will not come out to say what they are going through. But when they hear things like this, it helps to, to encourage them. It helps to that's okay. We can also share it with others.
Benny, our niece nieces, friends, colleagues, neighbors,
Aláwọn ọmọbìnrin, aláwọn ọmọ ẹ̀gbọ́n, ọmọ àbúrò, ọmọ ọ̀rẹ́.
Bẹ́ẹ̀ni, ẹ má jẹ́ ká máa di ẹnu, ẹ jẹ́ ká sọ̀rọ̀ ara wa síta.
Bẹ́ẹ̀ni,
because ẹni tó mọ̀ yìí ò mọ̀ yìí. Jẹ́ kéèyàn má kàn para ẹ̀ sí nínú ilé, kéèyàn má sọ pé ojú ń tì mí àbí nǹkan kan.
Ní gbogbo àwọn nǹkan tá a rárá ń sọ wẹ́rẹ́wẹ́rẹ́ yìí, ẹlòmíì kú sínú ẹ̀. ẹlòmíì
in
kú
fact
sínú ẹ̀
torí ẹ̀ ló ṣe jẹ́ pé mi kì í fi ìgbà tí mèyọ bá fẹ́ sọ̀rọ̀ mi kì í fi sílẹ̀ àgàgà
ẹ
nípa
jọ̀ọ́
health
ẹ
ṣe mọ̀ pé nǹkan
ẹ
téèyàn
má
ti
jí
go
mèyọ
through
lọ́wọ́ mi o
a
ẹ
lè
lè
jí
jí o.
mèyọ gbogbo wa lájọ ní mèyọ in fact tá a bá tiẹ̀ rérè kankan jẹ lórí ọ̀rọ̀ justice yìí tá à ń ṣe yìí
bẹ́ẹ̀ ni
tó
o.
bá jẹ́ èyí tí mèyọ ń ṣe fún wa yìí wàláhì ó tó lọ́tọ̀ ó tó
bẹ́ẹ̀ ni.
ẹni tó bá dẹ̀ ní ọ̀tá gan wá ń gbọ́ gbogbo ọ̀rọ̀ mèyọ ọ̀tá àwọn ọ̀tá ọmọ wù mí wọ́n wá ń gbọ́
ẹ̀yin ìyá yìí
wọ́n
ẹ
wá
ti
ń gbọ́
dalẹ̀ mi ẹ ti dalẹ̀ èmi
àdálẹ̀
tí mo fẹ́ dírágì mèyàn lẹ wá sọ pé so tí bá fẹ́ dírágì mi ní rí sọ́pọ́tà kankan sí.
ẹ lè rí sọ́pọ̀tà ẹ̀yin team green.
sorry o
ẹ ti gbọ́ kọ́tọ́.
sorry o
president bí mo ṣe fẹ́ràn yín tó ẹ̀mí ìfimi ìyọ́bálẹ̀ kankan ṣeré o.
I like you but sorry I will not support you in that.
ó ti da
láyé mèyọ èrò pọ̀ lẹ́yìn yìí ẹ lọ gbàpò tìbò.
ó ti da.
president wọ́n ní kẹlọ sẹ́ńpẹ́ wọ́n ní kì í ṣe time president là ń sọ yìí. ẹ pé president kì í fi president ṣeré.
No, it's not like that.
It's not like that.
It's not like that.
green a fẹ́ wá fún mèyọ ni
ayọ̀rọ̀ kò.
a fẹ́ wá gidi ni fún mèyọ àwa team green.
ẹ̀yin team kí lẹ pé yìí.
team green.
ẹ rántí àwọn team green àti team pink gbà yẹn wọn mi dé sílẹ̀.
a ń ṣe mítìnì lọ́wọ́ a fẹ́ re-strategize báyìí máa pàkì mèyọ.
president èmi náà tiẹ̀ ti gbàgbé ọ̀rọ̀ àwọn yẹn.
àwọn team green ti gbọ́ ọkọ pátápátá parí lórí Facebook ó ti gbà pátápátá o.
irọ́ ni o.
pátápátá ó ti gbà ó ti ta lé ní UK ó ti lọ fi fọ́kọ.
Jesus Christ.
ó wà ní Facebook.
Bóyá omere ṣe dáadáa èyí mọ̀ ẹ mọ̀ ara àwọn nǹkan tá à ń sọ náà nìyẹn kọ́ máa bọ̀ kọ́ wá kẹ́kọ̀ọ́ wọn ní wá.
It means that they haven't diagnosed you having diabetes yet, but you have a higher risk. And usually for a normal blood sugar level, so for diabetes, you're looking at the blood sugar level. Yes, so they would have checked your blood sugar. For UK reading, we look at millimole. Is it millimole? Yeah. So it should be between fasting blood sugar should not be more than 5.6, and if you've just finished having a meal, it shouldn't be more than 7 to 8 ideally. But if it is consistently more than 8, you are at risk of developing diabetes, but you are not having diabetes yet. So it's a serious thing to look into. And another risk factor is if you have a strong family ties of maybe you have a sister or a brother, a father or a mother that have diabetes, you are at risk of having that type 2 diabetes. Now we're looking at type 2 diabetes. That is when you'll be diagnosed with pre-diabetes. So there is type 1 diabetes and there is type 2 diabetes. So we're looking basically at type 2 diabetes. So if your reading has been consistently more than two times, I think, of having fasting blood sugar and it's more than 7 or 8, they might tell you have pre-diabetes, and you might be they might tell you have pre-diabetes, and they will, for a normal working system, they will refer you to specialists. You're looking at lifestyle modification again. We're looking at lifestyle changes, what we eat. Most of our food it's just one-time reading. Maybe I won't bother láti máa stress, but they should check it again. So if they tell you at one-time reading, was it fasting blood sugar or was it after you've eaten something? Because the bá ṣe jẹun tán within 2 hours of eating something that is, so you should tẹ́ wà ní kíní, you can buy the sensor, this thing. They sell, if you're in UK, they sell it in Boots, or if you're in America, they sell it in the shops. Yeah, the AC1, HbA1C test. So that's the one they are going to be checking in 3 months. So within that 3 months, or did you just have a baby? Because if you've just have a baby and you have gestational diabetes, they will ask you to come after 3 months just to have that diagnosis. So the 3 months they are looking at is to have a definite diagnosis. So I will say, look at what you're eating, because if you have a strong family history, for we do. No, so what was the result, Buki? That should not be giving them that diagnosis. If you've had tea in the morning and they did that test, no, go ask them to recheck it instead of waiting for that 3 months. That is the wrong reading, but I don't know what the result was. So if it's within 7 and 8, you've had something that has sugar, it's obviously going to give a wrong reading. So they can't just diagnose you with that without a fasting blood sugar is what we normally we use. Is the fasting blood sugar. So go back and check. But tẹ́ bá ń lọ, alẹ́ lẹ ti máa jẹun, so tẹ́ bá máa fi ṣe test yẹn láàárọ̀, ní tí jẹ anything, you've not eaten anything, that's why it's called fasting blood sugar. That's when you can have, so it should be between 5.6, 5.7. So then they can tell you have pre-diabetes. But that being said, lifestyle modification, especially for our dudu, we are at risk of diabetes because of our food, our lifestyle, our parents have it. We are at risk of heart disease. We are at risk of kidney disease. So diabetes will cause kidney disease. Kidney disease will lead to end-stage to renal issues, and in extreme cases, end-stage renal failure, chronic kidney disease. All these things, and it messes with our life. It messes with this thing. The BAMS. Oh, you've had 2 readings. So are they telling you have pre-diabetes? Yeah. Mommy Dupsy babes. Èmi tún máa ń polówó pineapple. Ẹ fẹ́ káwọn èèyàn mi jẹ pineapple. So they're telling you have this thing. Some fruits we eat good. So as much as we want to eat fruits, we say, oh, fruit is good. Some fruits are high in sugar as well. Yeah, Princess, increase your fiber intake. Eat more food. Eat food that are high in protein. Fiber, raw veggies are very good. Avoid mango if you can. Avoid pineapple. Now, my pineapple is at risk. If you can, So you're looking at those things. Yeah, so pre-diabetes is a very serious thing. Don't just look at it. Change your lifestyle. Our food, eba, eba is not too great. We can eat this thing, but in small quantity and not every day. And we should eat our vegetables, spinach, our vegetables, avoid sodas. Yes, you're right. Avoid sodas, avoid alcohol. Nigerian food that are high in fiber, plantain, especially the especially the black plantain. Now in your plantain, oats are good as well. You can use the oats. I've seen somebody mix quinoa, or people have different pronunciation for it. As in swallow. Go for a walk. If you cannot do big exercise, go for a walk, 30 minutes every day, average, or 3-4 times a day. Yeah, unripe plantain. Thank you, Ogede. Plantain, unripe one, the ripe one. Elefiche, swallow, all these quinoa, all these whole foods, they are very good. Unripe plantain, nuts. Egusi, I won't really, Tori Bawa Sheman say egusi. Egusi is one soup that I would really love us to talk about. Egusi is good, but Basheman say egusi. Bóyá àwọn tí máa rí ilé online ṣá o. Epo tó máa, tí bá wo àwọn some food kíní, tí bá rí epo tó máa ń bù sí egusi, ẹ̀rù dẹ̀ máa bà mí. Màá dẹ̀ máa wà, àyà dẹ̀ máa já. Epo bá ṣe máa ń ṣe ẹ̀gúsí wa, a fẹ́ kó look fanimorous. It's not good for us. Instead, Yeah, egusi has high cholesterol. It's as much as we like our egusi, it has high cholesterol. Except about fear, there are a lot of vegetables. You can use kale. You can use spinach. Aubergine too is very good. Yeah, you're right. You can make it into swallow. I've seen. Yeah, there are so many things that can be used into swallow these days. Yeah, all these seeds, nuts, are very good. So they are source of fibers. So we can sort of reduce our this thing, our swallow intake. Oúnjẹ rice, white rice is another culprit. So kì í ṣe swallow nìkan ni problem. White rice is another culprit. So you can go for brown rice, or the basmati is not too bad for somebody for a normal lifestyle, but if you're at risk of, if you're trying to watch your weight and all those things, yeah, quinoa or quinoa, it's pronounced differently, but the quinoa, yes, princess, you're right. You can blend it with oats and make it into a flour and sort of efficient. So yeah, so for pre-diabetes, please be mindful. Don't just overlook it. It is a health, is very serious. Tabati jẹun tán, tá máa gbé malt, we can reduce it. If you can cut off bread or white bread, cut it off. Just go for whole wheat or whole wheat bread. So yeah. So that's for pre-diabetes, but they need at least 2 readings before they can just say you have pre-diabetes. And change your lifestyle so that by the time you go for the test next time, it will be within range, and just keep to that lifestyle. Perimenopausal. What do you want me to talk about in perimenopausal? it's how do I put it? We've talked about it some times ago. I believe most of us here are above 45, and it's something a lot of people are dealing with. Yeah, it's something a lot of people over here are dealing with, above 45, symptoms and all these things. So it depends on what you want me to talk about in perimenopausal. Perimenopausal is just, you are at the verge of being menopausal, and because the period, having period is our brain stimulating the ovaries to release the hormones that our body needs to function normally as women. But because it's not coming as it's not coming as it should be, so it's sort of like you are in between the devil and the Red Sea, deep blue sea, or the Red Sea. So it depends, honestly, but to help women with perimenopausal, we've talked about lifestyle modification here a lot. So changing your lifestyle, you can speak to your health provider. If they think you might need hormonal replacement therapy, they might look into it, and just take your vitamins, eat well, because your body is not triggering. So yeah, perimenopausal is a big topic in the sense that you're not there yet. You haven't left your period stage, and you're not there yet. Mommy Ashabia, you can ask your question. You're not there yet. So it's like in between. So our lifestyle can help while we...
Mayor.
Ma?
Yes, ma. Ẹ jọ̀ọ́, mo fẹ́ béèrè ni o. I'm 53 now. Mo dẹ̀ ṣì ń menstruate. Ṣóyè yín. But menstruation yẹn kò ṣe pé ó ń wá every month o. Ó lè lọ bóyá bí 6 months. Kó yá kó tún wá. Ó dẹ̀ máa wá normal as period ni. Though before torí mo máa ní heavy float gan. So mo á ṣe ìgbà yẹn mo ṣì wà Nàìjíríà, mo á ṣe wọ́n ṣe Mirena kinní kan fún mi ṣá, mi mọ̀ bóyá ẹ mọ̀ ń pa wọ́n ṣe fún mi exactly wọ́n ṣe fún mi nígbà yẹn, so ó jẹ́ kí flow mi kó reduce ní gbogbo ìgbà yẹn. So wọ́n wá sọ fún mi pé by the time tó bá máa fi pé 5 years nígbà yẹn wípé màá ti wọ bí menopause so that kinní yẹn wọ́n á lè yọ ńgbà yẹn. But later by nísìn ó dàbí pé kinní yẹn wọ́n ní ó ti lè lo 8 years nísìn. So mo ò tí ì wá yọ torí ẹ̀rù ń bà mí kí n má lọ lóyún. So ẹ̀rù ń bà mí pé kí n má lọ so mo wá yọ. So wọ́n sọ fún mi ní bíbá torí UK mo wà. So wọ́n wá sọ fún mi pé kí n má yọ pé since tí ó sì lè lo 8 years ní ara mi. So mo á wò ó pé ṣé kò yẹ kí n ti stop láti máa ṣe menstruation yẹn ni torí ó tiẹ̀ ti sú mi. Ìyẹn mo ní kí n béèrè pé kí lẹ lè rí sọ sí mà.
You are so lucky, honestly. We're lucky because the truth is, as much as the menstruation could be inconvenience, it is helping you a lot. And one of the things that our period helps us with is this sex. You know, I talk about it a lot. It helps us to function well. It helps our body. It helps a lot because you're still not perimenopausal, even though your age, so it doesn't matter. So so you are still not there yet, you know, but it's helping your body. In as much we are still menstruating, it's helping our body to do what it should do, especially as women. It helps our sleep pattern. It helps to stabilize our mood, you know. You're so lucky, honestly. It helps your sleep, helps your sexual drive. It helps our brain. It's telling our brain is still telling the ovaries to still keep producing the hormones. Is it the follicle stimulating hormones that helps us generally? So with perimenopause or menopause, one of the things to might affect obìnrin, it's reduced sexual drive and it dry, you know. But these days our teachings are things that can be dry. I'm a hot flushes. It is these things that is going on in our body. So you are still having it, your body. So there are so yeah. So for the perimenopausal, these are the problem: hot flushes, change in the sex drive. Ìgbà mi ara máa gbóná, ìgbà mi ara máa tutù, ìgbà tí gbogbo èèyàn bá ń gbóná ara tutù, ìgbà tí gbogbo èèyàn bá ń tutù ara máa gbóná láti know why you can't explain how you feel. And because you cannot explain how you feel, our family, our husband, they do not know how to help. So your mama konra, you know. So because but because yourself, you cannot tell what is going on in your body. It is the changes that is going on. So it's what is going on. So irregular periods, you know, months next month. So you can't really plan yourself. So in Tabangbe and Bagjade, you're always having a pad in your bag because you're not sure when it can happen, you know. Sleep problem. Your body is not you know, so yeah, so those are things that happen with perimenopause. Headache, yeah. But when you're in perimenopause, please drink water. If you don't have kidney problem, drink enough water, because if you're not drinking enough water, it will affect your bladder as much as we might not like it because of the dryness. Your body is dry. You can't just explain it. Moderator Ejeba blocky kinito wole. For people looking for baby, being in perimenopause stage, we decrease the chances of getting pregnant. It's I'm unstoppable. It could be your lifestyle, you know, you could be eating well, doing all the right thing. So it's not everyone that will experience it. So yeah, that is, and also another problem is the change in bone density. So we need to go out in the sun. For we that lives abroad, use your calcium, use your magnesium, eat foods that are high in fiber, foods that are generally good, food that are high in magnesium, food that are high in fiber. So, yeah. Everything by Temitope, I think you should. How long? For years you haven't seen your period. What is your age as well? So is either you're in menopause, depending on your age, but you need to speak to your gynecologist. You really need to speak to your gynecologist because ideally the implant is not supposed to stop your period. It's not an avenue to stop your period. So it could cause irregular period, but it's not supposed to stop you from not seeing your period at all. So speak to your gynecologist. They need to see why that has happened. Yeah, so for people asking about perimenopause, did I answer your question a little bit? Thank you, gifters. So that is the main problem with perimenopause. But generally, people won't want to do anything about it because you're not there yet. But for the people that are in menopause, and if it is disturbing you, you might be needing hormone replacement therapy, Somebody having low sex urge, it could still be the perimenopause we are talking about. It could be stress. Stress is a number one problem for having low libido or low sex urge. Is your partner not physical this thing as well? If you are not physically attracted to your partner, might not stimulate that part of your brain for you to want to get down with them. That is the truth. If there's problem in the marriage, if there's problem in the home, it could be another trigger. So all these things, all these physical things needs to be looked into before we talk about hormones. But hormones is a big factor as well. But the physical aspect, some people are very very finicky. Elomiti and Tobawa Peluto very neat. They won't get down with them. So look at those physical things. Are you still physically kini? Àwọn ọkùnrin mi máa ń feel pé torí àwọn ọjọ́kùnrin the obìnrin máa fẹ́ bá wọn sùn. No, tẹ́ bá lọ yọ ikùn. Ẹ̀yin ọkùnrin, ẹ má kàn lọ yọ ikùn kíní o. Ẹ̀yin náà exercise o. Because those things, if your partner is not getting you there, if your partner is selfish, you won't want to get down with them. That is the truth. And tó bá jẹ́ pé kó kàn wọlé kó jáde, kò gbé yín débẹ̀, kò fẹ́ ṣe foreplay and all those things. These things are important. That is the truth. They are important. It might make you have low sex urge or low sex drive. But for women generally, dryness too. If it's dry, one of the reasons, if it's not hormonal imbalance, if it's nothing to do with your body, if the man tí wọn bá gbé yín débẹ̀ dáadáa, àwọn kan tẹ́ bá ti mọ̀ páwọn ẹlòmíì tẹ́ bá ti bọ́ṣọ tán ti rí ọyàn tó point tán rí dì wọ́n kàn fẹ́ kókó bọ̀ ní ẹ má bínú o, bọ̀ ẹ̀jẹ̀ bá wa power tap o, bọ̀ tán bá gbé yín débẹ̀ tí mood yẹn bá wà alright, tí ẹ ti tán náà blue, see the room is nicely lighted, is nice and warm, wà over full, kì í ṣe pé ti lọ jẹ iyán tẹ́tí kún ti lé, tí kún bá ti lọ lé jù, for birth control, that comes under hormones as well, because your birth control is giving you hormones, so it could cause low sex drive. Endocrine, we've talked about the thyroid earlier. Those two can be a factor as well. Your brain stress, normal life stress, work stress, is something bothering your mind, all these, if they are not resolved, baby soft, so that mo sure pé lálẹ́ Ọlọ́run kú ṣálẹ́ Friday láwà, so àwọn dájì kan máa ti máa pé ọpẹ́ o, mèyàn ti wá fún wọn lecture, ọpẹ́ bí ìtẹ̀rántí pọ̀ ní Friday, prof ẹjọ́ bá gé prof up o, òní ní Friday àwọn dájì kan máa gbádùn ara wọn lálẹ́, gàrá nìyẹn, ẹ wá pick prof up. Ènìyàn burú, ẹ má bínú o, mo ti gba kíní látẹ̀ nǹkan. So àwọn kan máa bú mi lọ́la ń sìn wá ní mo jẹ́ kí gbogbo ẹsẹ̀ àwọn gbọ̀n. tí wọ́n bá ti gbé wọn débẹ̀ pododo of Komosan má bù mí lọ́la o torí tó bá dọ̀la ń sì wá ní ẹ̀yìn ń sunkún àwa wà ń bí à ń damira má bù mí jọ o má bù mí o òkè ní ọ̀bùrú má bù mí o àwa máa damira o kò tó bá dọ̀la ń sì wá ní àwọn kan ń sunkún àwọn tí ń wùn mí àwọn ń damira ẹ jẹ́ ká damira o.
wọ́n dábìrà wọ́n dá mi ẹnu àwọn wèrè.
èmi náà máa bú ń sìn bẹ́ẹ̀ wọ́n á sọ pé kinní kan èmi jẹ́ kẹ́sẹ̀ yín gbọ̀n ẹ jẹ́ kí wọ́n gbé yín débẹ̀ kẹ́sẹ̀ yín gbọ̀n so for the low kinní I mean ìdílé kẹ́sẹ̀ gan-an for that look into all these factors, the physical factor, the hormonal changes, the stress, honestly life stress, both for we women, stress, ọkọ, ọmọ, iṣẹ́, oúnjẹ, wo ni mo fẹ́ sè, those things are factors. And tó bá dalẹ̀, if your husband is not helping, join daddy wa, please assist at home. Honestly, it's very important. Believe me, when you help your wife, kẹ́ tó sọ pé ọmọ báwo lọ́wọ́ ẹ̀, wọ́n ti da gbogbo tọwọ́ ẹ̀ lẹ̀. Honestly, I'm giving you that trick. Don't rí pé ẹjọ́ ṣe, she's not overwhelmed. She's not burdened with everyday life, everyday issue, massage keto ki nǹkan bọ́nú nǹkan, have that, let the mood be right. Gradually it helps. Even for the older folks, even thinking to dry, when you go nice and gentle, everything, it's easy. The vagina is very amazing. It's one of the most amazing organ of the body, of the woman reproductive system. It is amazing. It stretch. It will accommodate you. And everything by it. Speak to your provider before you remove it. Speak to them first, please. But let them know you've not seen your period. So many things can be a factor. 3 years, wow. Yeah, the 3 years on, yeah, but how it shouldn't honestly totally stop your period. So speak to them. They might want to remove it, truly. They might want to remove it and see how it goes. So, yeah. So speak to your gynecologist first, speak to your family planning provider, let them see why, why you're not having your period. They might want to even do a scan, they might want to scan your womb to see, your uterus or your abdomen to see what's going on, why you're not having your period, So yeah, so Ejo, so you just stop breastfeeding. It's been shown that breastfeeding can stop period. So yeah, that could be a reason. But if you don't want to get pregnant yet, and if you've just stopped breastfeeding, so maybe if you stop the breastfeeding for like a month or 2 months, and see before you take it out, but still speak to your because if you're actively breastfeeding, for some people it stops period from coming. Prof is okay. Yeah, so then that could be a reason. Everything by it could be a reason, but still, if you're worried, we should learn to. Another thing is for us to learn to listen to our body. If you're worried, then speak to your provider, please. But generally speaking, for most women, breastfeeding every period, you might not see your period. So yeah, for the sex part, she was satisfied with the sex part. Help, And your ọkùnrin, má jẹ iyán tán ní 6 p.m. kẹ́ wá lẹ fẹ́ ṣe kínní. Ẹ jẹ́ kó relax. Ẹ jẹ́ kí body. Even for we women, téèyàn bá wà over full, kò ní jẹ́ kéèyàn ní urge. When you're tẹ́ ti yó jù, ẹ jẹ́ kéèyàn ní urge. Tán bá gbé, tell your ṣẹ́tìrì ayé sọ̀rọ̀ sókè láwà. Ẹ sọ fáwọn dádì yín bẹ́ẹ̀ ṣe fẹ́ kán fọwọ́ kàn yín. Kì í ṣe pé ojú ń tì mí, mi ìfẹ́ sọ̀rọ̀ kó má rò bóyá kinní kan. Ọkọ yín ni wọ́n, partner yín ni wọ́n. They are your number one protector. They should know how you want to be touched. Bóyá kán fi orí ọmú ṣeré ni. Bóyá tán bá ń mu ọmú kan, kán máa fi ọwọ́ èkejì tàkòtó like. Talk to them. tó bá yẹ pé kán fi ọwọ́ ọkùnrin kì í ṣe pé kẹ́ máa fọwọ́ gbo clitoris kẹ́ máa gbó rárá. Nice and gentle, slow and steady win the race. Ẹ má lọ jẹ pepper soup, kẹ́ má lọ wash your hand. Don't go and be digging your dirty hand into the woman's kidney. Ẹ jọ̀ọ́. Slow and steady wins the race. So speak to them, you know. Tẹ́ bá like kán máa gbé wọlé látẹ̀yìn ni. Speak to your partner. Have this communication. It helps. Ẹ máa di pé so because if they are not giving it to you the way you want it, it can lead to resentment. If you're the only one in a call and ṣe gbogbo wàhálà ilé, you see pé ọkùnrin mi ò mọ bó ṣe ń gbé omi kaná. Tán bá gbé omi, tẹ́ bá ní kí ọkùnrin mi gbé omi kaná, omi yẹn máa jóná. Wọn ò mọ bó ṣe ń tan kettle. Ẹ lè ṣe tíì fúyàwó yín. Òun ló máa jí láàárọ̀ máa ṣe gbogbo ẹ̀. You'll be tired. That is the truth. Kì í dẹ̀ ṣe most home are not one single income home. Ìyàwó ń ṣiṣẹ́, ọkọ ń ṣiṣẹ́. So ṣé kàn block mi? Why mọ mi ìdílé kẹ̀? Kàn block mi. Kàn ṣe slow and steady. Kàn máa di àwọn èèyàn jòsí tó máa kọra mọ́ wa ń bì. A máa kọra mọ́ wa bí ẹni pé àlà kó bá wọn. Ẹ má kọra mọ́ wa o, ẹ jọ̀ọ́ o. Ẹ sọ fáwọn ọkọ yín, ẹ má tìjú. Ẹ má ẹ̀kọ́ kan yín jókòó sórí TikTok láti àárọ̀ dalẹ́, gbogbo bẹ̀yẹn á ti gbóná, á máa gbá. Kò sí obìnrin tó fẹ́ gbé okó tó ń rùn sí ẹnu. It is fact. Ẹ má ṣe kínní, ẹ lọ fọ oko yín, ẹ fọ abẹ́ yín, ẹ má sọ ibẹ̀ di gbórùn mọ́lẹ̀. Ẹ wash, ẹ clean, ẹ gẹ punk fún, or kẹ bá abẹ́, or kó gẹ skin. Kó look nice. Use nice spray. Obìnrin kọ́kọ́ ló ń lo spray. Use nice kini, smell nice. Ẹ má ṣe kun gbẹ̀ndùgbẹ̀ndù bí kini, because tí kùn bá ti tóbi jù, oko máa sá wọlé, ó máa kéré. Ẹ má di pork yolk kalẹ̀. Daughter of Grace ibo lẹ ń sá lọ. Ẹ má di pork yolk kalẹ̀. Tó máa kanra mọ́ wa lórí ìkànnì yìí. So ṣe kini. Ẹ má di pork yolk. Tó máa di pé àwọn ló máa kanra mọ́ because wọn ò gbé débẹ̀. Ẹ jọ̀ọ́. So ẹ̀yin náà ẹ bẹ̀rẹ̀ sí ní go for a walk. Start changing. Ẹ má lọ mu mókòlè, ẹ má mu làkókò. Ẹ má mu gbogbo nǹkan yẹn. You know. Ẹ má mu ẹ má mu làkókò, ẹ má mu mókòlè. Ẹ jẹ oúnjẹ gidi. Have conversation, communicate. Communication is very important. And if you've looked into all these things and it's still a problem, speak to your doctor. Maybe so. Okay, keep ènìyàn burúkú á continue. Káwọn èèyàn á má lọ wà oversaturated báyìí. Kọ́ má lọ wà oversaturated. Ike àti overteach wọn. Ẹ má bínú. Yeah, so those are things that Daughter of Grace ibo lẹ ń sá lọ, ẹ má padà bọ̀ ń bí. Bless you. Ẹ padà wá síbí o. Ibo lẹ ń sá lọ. Ẹ fáwọn dádì wa ṣe o. Ẹ jọ̀ọ́ o. Ẹ má sọ pé ó ti rẹ̀ mí. Ẹ̀yin dádì wa náà, ọmọ tó bá ṣípá nìyẹn máa gbé sókè o. Tẹ́ bá ṣe nǹkan tó yẹ kẹ́ ṣe, ẹ máa rí bó ẹ máa ti lọ gbájú ara yín jù. Ẹ̀yin gbà pé kí ló ṣẹlẹ̀? Ẹ máa enjoy ara yín because wọ́n máa fún yín ṣe dáadáa. You know. Daughter of Grace, báwo ṣe fẹ́ corrupt ears yín? It honestly, lifestyle modification, all these things. Ẹ̀yin go marry, and especially for women over 40, you can talk, speak out. You know, this is not Ojuntimi, Kinekon. Speak out. You know, most of these men want more how to deal with this. It's only when you've spoken out, you've told them what the problem is. Get them involved in your health. Okay, baby soft. You know. Get your partner involved in your health so they will know what is going on and they can know how to help you as well. You know, because àwọn ọkùnrin yẹn wọn kì í ṣe spirit. Wọ́n kàn máa pọ́n kanra, you know. Let them know how they can help. Let them know how they can get involved. And it sort of ease the stress. Mo ti gba kíní látẹ̀nkan. Right? Yeah, it shouldn't stop your period. So, yeah, speak to your health provider. Let them check other factors. Yeah, it's really not good, because if your period is stopping, it's sort of like not helping our body. Our body still needs that period. We need that hormones to be released, you know, for us to function well. You know, it helps our sleep, it helps our mood, it helps our sex drive, it helps our bone, you know, it actually helps our bone, you know. So yeah, everyone that is asking to be picked up, share to request. Moderator, share one bẹ́ẹ̀ yẹn. Ẹ jẹ́ request. Ẹ̀yin J4M, ṣe ti rí láti ẹ̀kan sí àṣẹ J4M látàárọ̀. So we are not just here for J4M, we are here for ourselves. Mommy, let's be talking about okay.
Okay, mo ti ríra mi mọ́ wa, okay ma. Ẹ káàárọ̀.
Ẹ kúrò lẹ́ mà.
Yes ma. Ẹ ṣáà kú àgbálẹ̀ wa every time. Question kan ni mo ní.
Okay ma.
Concerning that lady tó sọ pé òun ṣe IUD, òun ò rí period òun. When I went to go and change mine this January, wọ́n sọ pé it's two. That one you can have your period, one you might not have your period. You won't even know when it's coming, you will just say it. So nǹkan tí mo fẹ́ chip in yẹn, maybe she went for the one that's wọ́n ní kò ní jẹ́ kó yàn ṣe period. So other could add that new thing now. Okay. This was on the 7th of this month.
Okay.
Mo lọ change it, yeah.
Okay, so that's a good information for people that the IUCD stop. So yeah, that's why I said speak to your provider. There is a label to man give, so one man more. So speak to them. They will know which one they've put in, you know, to know if it stops. Even if it stops, so if it's the one, mommy, let's be talking. If it's the one that stopped it, that means your body is still releasing your hormones that your body need. So you're just not seeing the period, but if not, still speak to your provider and let them see, you know. Yeah, so yeah, those are the things that people might not know. So it's a good thing we asked, and some people we know the one we might want to go for, you know, because some people don't just like to see the period, but it's just that when the hormones are stimulated, it helps our body generally. I might not go into the details, but it's generally help our body, you know, especially Team Green don't fi kíní gbọ́kọ́. So yeah, Prof, ṣé wà okay?
Eyo, ẹ kú àtàárọ̀, ẹ kú iṣẹ́, ẹ ṣé o, ẹ kú lecture. Now, you have actually spoken about men a lot. Àtàwọn tó yẹ pé tó bá ti gbé kinní lẹ̀ báyìí kó tó fi sí tán, ó ti da gbogbo ẹ̀ lẹ̀, whatever. Now, kí lẹ fẹ́ bá a sọ fún àwọn obìnrin tó yẹ pé they don't do foreplay, àti kiss gan wàhálà ni, débi gan tẹ máa ṣe, they don't really, you know, like too much playing and all that. Ẹ bá advice wọn kó máa gbá wọn kọ wọn débẹ̀. Ẹ ṣé.
Prof, ẹni nǹkan tó gbé Prof gòkè, maybe so ṣe
Torí ni nígbà tó jẹ́ àwọn tàwọn ọkùnrin lẹ̀ ń sọ ẹ̀ sọ tàwọn obìnrin. Àwọn obìnrin jẹ́ pé ọkọ̀ bá sùn lẹ̀ bí lọ́gọ̀ búùdù.
Ẹ̀yin obìnrin ṣe gbọ́ wọn ní kẹ́ má sùn gbalaja o, wọ́n ní kẹ́ wà involve ju kò sí anybody tó wà níbi tọkọ máa sùn gbalaja láti ibi 2 years àti ń sọ, kò sí obìnrin tó wà ní platform yìí tó ń sùn gbalaja. Mo fẹ́ sọ yẹn wípé wọ́n máa gbé yín débẹ̀, wọ́n á gbókó sẹ́nu, wọ́n á ṣe gbogbo ẹ̀. But the thing is, honestly, I talk about hygiene, personal hygiene for the men, you know. Be mindful of your hygiene. This is not 20, 30, 40 years ago. This is period when women know what they want. Be mindful of your hygiene. Brush your teeth at least twice a day. brush your teeth tẹ́ bá jẹ ẹja tán, tẹ́ bá jẹ garlic, brush ẹnu yín.
Bínú máa wọ́n ti fọ́ọ̀lù àǹjì yín ní comment section lọ.
Kí ló sọ?
Ẹ̀jẹ̀ kún ọ̀sìn bí ẹ ti ń rí ìwé àtáyà ní now ẹ ti ń rí ń bẹ̀ yẹn wọ́n ti fọ́ọ̀lù àǹjì yín.
Ẹ gbọ́ ẹ lè tired o because àwọn ọkùnrin wa tó wà níbí wọ́n ń try, they are good men, so ẹ lè kàn sùn gbalaja, mi ò lè gbà yẹn o. If not, màá ní kí host block gbogbo yín tẹ́ ń sùn gbalaja tẹ́lẹ̀ ń táyà, ẹ ṣe máa táyà bíi ti báwo. Ẹ má táyà, ẹ má fọ́ hand mi o. Yeah, so bẹ́ẹ̀ ni scrub your tongue, òun náà ti ń kọ síbẹ̀ yẹn. Àmọ́ mi ìdílé kẹ́ má walk away o. Ẹ lè tired. Kí ṣe gbogbo ìgbà la máa lé owó. You know, so when the men have done their part, they've been mindful of their personal hygiene. Wọ́n ti wà wọ́n help yín nínú ilé, wọ́n ń ṣe gbogbo ẹ̀. Your own part is ẹ fún wọn ṣe dáadáa. Look, honestly, for you the women, tán bá gbé tẹ́yìn gan bá débẹ̀. Ṣé ẹ pé nígbà mi tẹ́ bá wo oko ọkọ yín, kẹ́ má rí gan kẹ́ ronú pé oko ọkọ mi tó dàbí ọ̀gẹ̀dẹ̀ àgbagbà yẹn. Ìyẹn gan máa fún yín ní urge. Àbí ẹ mọ̀. So learn to love what you have. You know, ẹ̀yin obìnrin wa ẹ má táyà o ẹ jọ̀ọ́. Learn to love what you have, you know, is another thing. Being contentment. You know, when you love what you have, when you look at it, pé tí ọkọ yín bá bọ́ta nínú bathroom, tẹ́ bá rí kíní yẹn gan lásán, ẹ jẹ́ kí ó máa fún yín ní feelings pé ọmọ ọmọ, you know. They can ask for it every day. Mi ò lè sọ pé come ask for it every day. I mean, I won't say that too. They can ask for it every day in as much tó bá ń ṣojúṣe wọn nínú ilé o. Wọ́n máa ask for it every day. I'm not going to be part of that, not asking every day. Ẹ jẹ́ kán jẹ to the fullest. Which type of oil? Very. So yeah, ẹ jẹ́ kán béèrè every day. Honestly, our men have raised a complaint because Prof is aṣojú of our men, and I will not overlook the complaint. Ẹ̀yin fi ṣe ti rí mọ́mí ọmọlúwa the everyday yẹn gan is after some time wọ́n máa calm down. But ṣe pé tí nǹkan bá dùn, ìgbà míì tí nǹkan bá dùn, you want to eat it all the time. So look at it that way. Tó bá dùn dáadáa, pé àkíní adùn máa dẹ̀ ẹ̀kẹ́ o. You even should be glad your man is actually interested in you to want to. Honestly, I see it as something, especially when we are at a certain age. You know, it is good. And believe you me, sexual relationship with your man helps closeness. To be honest, it's not just so she foreplay, kiss àwọn ọkọ yín, speak with them, have this communication, have this conversation, tell them how you want it, because some women are not satisfied. So you, the man too, you can raise it. Why are you not kissing me? Is because if you, my partner, cannot tell me if I have bad breath, then who is going to tell me? You know. So speak about it. Bó ṣe máa ń ṣe gbogbo yẹn mi ò like ẹ, mo fẹ́ kó máa go slow and steady. Okay, mo fẹ́ kó máa go slow and steady. Okay, so ọkùnrin mi like kàn lọ fast pa. Okay, tí ma ti ṣe first round, tí mo ti lọ pa. Okay, second one, màá lọ slow and steady. You know. Ẹ̀yin ọkùnrin, ẹ make sure pé àwọn ìyàwó yín náà ẹ jẹ́ kán dá mira, ẹ jọ̀ọ́. Ẹ má kàn lọ pa. Kẹ́tẹ́yìn bá ti dá mira, ẹ má dìde, ẹ má sọ pé kíní irọ́ o. Tí ẹ bá ti dá mira, ẹ béèrè lọ́wọ́ ìyàwó yín, ṣé o kọ́mù? So kọ́mù àbó kọ́mù. Kí ni mo lè ṣe? Kí ni mo lè ṣe tí wàá fi kọ́mù? So it's So Prof, ṣé mo answer question yín díẹ̀?
Ẹ ṣe jàre, ẹ ti tọ̀ ẹ ti rí pé àwọn tó wà ní comment section yìí gan wọn ò fẹ́ gbọ́ gbogbo training tẹ́ fún wa láti jẹ.
Prof, wọ́n máa gbọ́ by force.
So you need to come up more times now torí ẹ ti rí nǹkan tó ń ṣẹlẹ̀ mẹ́ẹ̀ àwọn pípù yìí tí wọ́n ti fẹ́ máa.
Mo ti kọ orúkọ gbogbo wọn sílẹ̀. Mama call wọn out. Mama call wọn out.
That's better.
Màá call wọn out. Ẹ lè sùn gbala báwo lè ṣe máa sùn gbalaja àbà no now. Mọ́mí Toyo Styles ẹ̀yin gan mo kọ́kọ́ mú sọ́wọ́. Mo ti kọ orúkọ yín sílẹ̀. Ẹ lè sùn gbalaja o. Tán bá béèrè everyday ẹ fún wọn o. Especially àwọn ọkùnrin tó ń ṣojú wọn kò try wọ́n try o kò easy. Kò easy rárá. Wọ́n bá yín ṣe gbogbo kinní wọn á di ìgbà táwọn ọmọ ò sí lé wá ní pé ọmọ báwo lọ́wọ́ ẹ wá ní kinní kan ó rẹ̀ mí. Báwo ló ṣe rẹ̀? Ó wà ní kitchen mo bẹ rálùbọ́sà. Mo bẹ hoover ilé. Mo lọ mọ́ school. Ṣé olùwé àmọ́ kan ṣe lásán ni mi ò ní ṣe lásán o. Á jẹ́ iṣẹ́ lásán o. Tí àwọn prof pé táwọn ọmọ bá especially tí àwọn ọmọ ò bá sí nílé yẹn is usually the best time. You are free. You lose all inhibition. Kò sí ẹni tó ń disturb. Ẹ má ṣe yẹn, ẹ má sùn gbàlájà o. Tó bá bẹ̀rẹ̀ everyday, in fact tó bá bẹ̀rẹ̀ 3 times a day, give it to them.
Èèyàn ó dà pé mọ́mí ìdílẹ̀kẹ̀ fẹ́ mú àwọn style táwọn lè máa ṣe lẹ́kọ̀ọ̀kan torí ìtàn kọ sílẹ̀ orí bákan.
Mọ́mí ìdílẹ̀kẹ̀. Oh dear. Mọ́mí ìdílẹ̀kẹ̀ ẹ gbọ́. Wọ́n máa gùn kí wọ́n máa béèrè.
Ṣé ti rí mímì òtítọ́ oní timetable?
Ẹ̀yin ṣe shift 9 to 5 ẹ wá lẹ táyà kí wá ní àwọn tó lọ ṣe 12 hours shift ṣe. Òun mo ṣe sọ pé you communicate you talk. Ń gbá mọ́mí ìdílẹ̀kẹ̀ wọ́n lè ṣe scissors o. Very soft. Your imagination of me is not pure. Let it be pure. So yeah. So Prof, ṣé mo answer yín díẹ̀?
Yes. G Classic, ṣé mo represent yín dáadáa?
Ṣé 96 lẹ́yìn ṣe choice by UK or 69? Ẹ lè ṣe 69. Ẹ lè ṣe oríṣiríṣi. Ẹ lè jókòó léṣu.
Style is actually dependent on you can just style, just enjoy yourself.
Prof, mo fẹ́ sọ àwọn styles ni. Hello house. Mo fẹ́ sọ style tí wọ́n bẹ̀rẹ̀ ni.
Oh yes.
Ẹ má máa ṣe mommy and daddy. Ẹ má máa ṣe missionary ti the old school. Àwọn Gen Z mama láwa ń bí báyìí. Ẹ jókòó léṣo, ẹ ṣe scissors, ẹ ṣe cowgirl àbí kí ló ń pè é. Ẹ ṣe doggy, ẹ ṣe wheelbarrow, jangrova, bó jẹ́ kitchen ló ka yín mọ́. Àga irú àwọn báyìí táwọn ọmọ ti dàgbà tó ti lọ school. Gbogbo ìgbà táwọn ọmọ ò sí nílé, ẹ̀yin àti dáàdi ẹ̀ enjoy ara yín. Ẹ yé mú ṣẹ́jú, ẹ yé mú shift jù, ẹlòmíì 16 hours ló ń ṣe lójoojúmọ́, ṣe fẹ́ para yín ni. Ìbùkún Olúwa ní mú nílà láì ṣe làálàá. Gbogbo ẹ̀kọ́ tí wọ́n ń kọ́ wa yìí tá bá ń lò nílé wa, àwa gan tá bá lò ní relationship àwa gan máa rí pé inú wa á dùn, inú àwọn ọkọ gan á dùn, inú àwọn ìyàwó gan á dùn. Ṣùgbọ́n nígbà tó ń tàn bá ti fi gbogbo ẹ̀ ṣiṣẹ́ ẹlòmíì tó bá ní pé ṣé snowstorm wà o, ẹ jókòó lé yín kẹ́ fara mọ́ partner yín kẹ́ ṣe gbogbo eré fúnra yín. Ìgbà yẹn lọ́sẹ̀ máa mú shift lọ́mọ aláwọn lọ ṣe pé extra owó lọ́mọ sọ́njọ́ yẹn. Some people, they don't plan for themselves. They don't even plan for their homes. Tó bá wá yá
àwọn ọkọ tó bá fẹ́ dó wa páńkọ́, àwọn ọkọ tó bá fẹ́ dó wa páńkọ́ ṣé àní sá kúrò nílé.
Ẹ jẹ́ kó lò sá kúrò nílé o. Yín pa á mọ̀. Èèyàn mi ò lẹ gbọ́ tán ni pé wọ́n do parí.
Kò yé mi o.
Ẹjọ́ do yín pa, lọ́wọ́ dídó yín pa àfi tí ń ṣe ẹ̀kọ́.
Kẹ́yìn náà ti adapt now, ó yẹ kẹ́ ti adapt. Bó ti mọ yín lára.
Nǹkan tó bá kéré ni èèyàn àdáàtì mọ́ nǹkan tó tóbi kíyàn tó tí ìdí kẹ̀dẹ̀rẹ́ tíyẹn ò tó tí ò fẹ̀.
Kí ló dé tẹ̀yìn náà tó jẹ́ tó ilẹ̀ yìí náà lọ mú lọ́jà?
Ṣẹ́ntìrì ó tóbi yẹn. Ẹ má dá wọn lóhùn, ó tóbi yẹn is not an excuse because the vagina is ó adapt.
Orí ló yàn wà.
Tí kékeré bá wá ń gbà yẹn ní dúró.
Orí ti gbé yín kọ aláwòrè kílẹ̀ wá ń complain.
Orí ti gbé yín kọ aláwòrè tó ká máa lò bẹ́ẹ̀. Àbí tó tóbi yẹn gan ló dùn.
Tó máa lè ní.
Èwo ni ká máa gbé yín kẹ́ máa kí káyà máa rìn yín. Lọ́dọ̀ yín kẹ́ máa gbin.
Láì ṣe yọ̀mí kéèyàn máa worú yọ̀mí yẹn.
Ọlọ́run ní jẹ́ àrírù ti yọ̀mí yẹn o.
Káyà máa rìn. Ọkùnrin nìkan kẹsẹ̀ tó máa látọ̀tọ̀. So nǹkan tó lọ ń fún yẹn lò dáadáa. Ètò ìgbà tí mo ti kéré máa sọ pé mi ò lè fọkùnrin tó sanra tó yọkùn. Ọlọ́run dẹ̀ yọ̀ ẹ̀ fún mi. Bí o ṣe tẹ bá rí ọkọ mi ṣáńjálá ni bó ṣe jáńjálá yẹn ibi tí mo fẹ́.
Lẹ́gẹ́lẹ́gẹ́ can destroy.
Lẹ́gẹ́lẹ́gẹ́ can destroy.
Bẹ́ẹ̀ ni àlọ́ fẹ́ yọkùn sí lọ́rùn.
Èwo ni kí n yọkùn kọ́kọ́ mi náà tún yọkùn. Níbo la fẹ́ èwo ni kí n yọ̀dí kọ́kọ́ náà tún yọ̀dí níbo la fẹ́ kí náà. Àwa máa wá obìnrin nínú ilé ànímọ̀ tó jóbìnrin ànímọ̀ tó jọkùnrin. Ẹjọ́ ẹ má sọ pé ó rẹ̀ yín o. Ẹ má sọ pé ó rẹ̀ yín tó bá ti ní ó yá ẹjọ́ yá at least tó bá ti máa ní pé ó rẹ̀ yín lẹ́ẹ̀kọ̀ọ̀kan kì í ṣe pé bóyá àwa náà kì í sọ pé ó rẹ̀ wá ẹ má jẹ́ kó jẹ́ all the time. Ara àwọn nǹkan tó ń gbé ọkùnrin jáde nìyẹn.
Bàbá tẹ̀ ń gbọ́ lẹ́kṣọ̀ mèyọ́ yìí á jẹ́ kára máa jí pépé kí mèyọ́ ẹ wá máa ṣe lẹ́kṣọ̀ fún wa lójoojúmọ́.
Àǹtí mèyọ́ ṣe rí sorry even gan kó rẹ̀yìn sometimes just cuddling up with small caresses and all that tó wà máa fi tó 30 minutes 1 hour you will start warming up. That is why foreplay is important. You can take an hour to play together doing something.
Club kan náà ni prof
àtọkọ mi. Mo ń ṣe kẹ́kọ̀ọ́ máa kó sí kinní kẹ́kọ̀ọ́ máa.
Ó dàbí pé club kan náà lẹ́jọ́ ń ṣe. Ẹ̀yin àtọkọ mi ó dà bẹ́ẹ̀.
Cherry, thank God pé prof ọkùnrin ló wá ń bá wa sọ. Àwọn nǹkan tí ọkùnrin fẹ́ nìyẹn. Àwọn nǹkan táwọn ọkọ wa yẹn fẹ́ nìyẹn. And if you don't give it to them, we tend to push them. Cherry ma. Ẹ jẹ́ kí n sọ instance kan fún yín. Mo ní ọ̀rẹ́ kan bí junior friend mi ni. Ṣé bẹ́ẹ̀ mi ṣe máa èmi dẹ̀ ni I'm turning 53 next in 4 months. Ẹ máa rò bóyá ọmọ bíi 35 àìmọye àwọn míì kan tó máa ń toast mi. Ọmọ 25 years old ti toast mi tó ní pé èmi ò jọ ọmọ 23 lọ mo ní o káre mo ní first born mi gan is more than that. You understand? So bẹ́ẹ̀ bá ṣe present rẹ̀ ni àwọn ọkùnrin yẹn ó máa ń push àwọn ọkùnrin míì síta àwọn míì lára wa àgbà tó bá ti bímọ méjì tó ti bí mẹ́ta wọ́n wá dára lẹ̀ wọ́n di grandma èwo ni kọ́kọ́ dé kó máa rí ojú ìyá ẹ̀ lára ìyàwó ẹ̀ àwọn nǹkan yẹn gan máa turn ọkùnrin off we should as obìnrin we should learn how to ṣe àmọ́ nígbà tí mèyọ́ bẹ̀rẹ̀ lẹ́ẹ̀kan tá à ń sọ̀rọ̀ mo ní pé we should learn how to be a wife be a mother also be a side chick. Nǹkan táwọn side chick yẹn fi ń gba àwọn ọkọ wa ojú pé gbogbo àwọn eré tá à ń sọ yìí obìnrin míì tó bá ti dáná tán báyìí gbogbo ọbẹ̀ máa rùn lára ẹ̀ kò ní lè sọ pé kóun ṣáwà kóun ẹ wá night wear tó dáa gbogbo àwọn nǹkan tí mò ń sọ yìí church ni wọ́n ti kọ́ èmi when I was growing up kì í ṣe pé kinní redeem ni mo ti ń lọ since I was 18 church ni wọ́n ti kọ́ mi nígbà tó ń tà ń ṣe àwọn believers kinní tó ń sọ nípa Christian marriage. Those are the things. Now some churches, they don't want to talk about those things. Pastor don't like nǹkan tó dáa. Pastor wo ló máa rí ọmọ tó set dáadáa tí ò ní padà tí ọkùnrin ní na is a man. You want to see.
Very cheap. Jemole cheap nǹkan. Very
cheap yeah.
Even Jerry, one thing tí mo fẹ́ sọ ni pé there are ọkùnrin that believe pé they are 2-minute men, they are not so active and all that. You try a long foreplay with them, try foreplay. too long, even allow them to come the first time. Why do you have not done anything? Why playing? Why having cuddles, romancing, and all that? By the time the guy comes back again the second time, you will see that it will give you the pleasure that you deserve. Foreplay, it gives them, that opportunity to last longer. So it's not about, but when you just touch it yourself, it comes in, it will just drop and that's all. But you just try the foreplay and see that it's going to change the drive and your love life will be ignited.
No, ara wọn kan tẹ̀ ṣe rí gbogbo àwọn kinní yìí ó dàbí eré bọ̀ kò ń ṣeré, they are real. ṣẹ́rí kan tí mò ń sọ fún yín, so bàbá yẹn ṣàwà ń sọ̀rọ̀, thank God ẹ ṣe prof, nígbà tí mo wá sọ fún òun láì gbé mi ṣe máa ń ṣe bí mo ṣe máa, mo wá sọ mo ní pé if you like the way I'm doing, tell your wife you want it. Ọ̀rẹ́ ẹ̀ náà ni tí mo mọ̀ ní o, ṣe ló àwọ̀ bra báyìí gbogbo èèyàn máa dàálẹ̀, àwọn tẹ́ pé ọmọ tí ò tí pé 40 tí ọyàn ti dàálẹ̀, ṣe kí ni mo ní ṣé wò rí bí ọkọ ẹ ṣe ń ṣe ni, bí ọkọ ẹ ṣe ń ṣe yìí kọ má lè bọ́kọ ẹ jáde kọ́ pé àwọn àmàlò bóyá ta ni grandma tó wà lẹ́gbẹ̀ẹ́. Mo ní if your husband is like that, ìwọ gan múra kó kí wọ́n gan kó múra kó dàbí 16 káwọn èèyàn gan máa wọ̀ ẹ́ pé tẹ́ni yìí ṣé ó ti pé kinní ṣá. But a lot of our women, àwọn míì ṣe mo fẹ́ ṣe ṣáṣe kan tó fẹ́ ṣe kó jẹ́ máa lọ. No. All these things, I learned them in the church. I'm in the Redeemed Christian Church of God. I'm a minister. And female ministers conference. Those are the things that spices the home. Everything. Reverend Adejimo, also man so koko. Only pe àwọn obìnrin ni ẹlòmíì tó bá ti ama bora ẹjọ́ ní ṣé ọkọ tí mo ti fẹ́ láti over 20 years. Ni mo ṣe fẹ́ máa bora fún ni mi ẹlòmíì ò bọ́kọ ẹ̀wẹ̀ rí nínú bathroom. Ẹlòmíì ò kò lè máa wẹ̀ báyìí kọ́kọ́ ẹ fẹ́ tọ́ílẹ̀tì kò dúró kó lè ọmọ apanet ẹjọ́ kí ni mò ń wò. Táwọn mi ò bá sí ilé mi mo máa rìn òun nínú ilé ni. Mi ò lálejò. Àwọn ọmọ nìkan táwọn ọmọ bá ti wà lé ni oníkálukú máa para mọ́. Ṣebí mi àtọkọ mi ni. So we should learn how to do all even kọ́ kíkíní yẹn gan máa àwọn ọkùnrin yẹn ṣe. Reverend Adejimo taught us one thing one time. Ó ní pé tóun bá rí pé ọkọ òun kò ṣe kinní tóun dẹ̀ ọlọ́wọ́ ìgbà ló máa wọ night wear tó yẹ pé níṣe ló fò àbí àwọn short kinní òun á ṣe bẹ́ẹ̀ ni pé òun fẹ́ bẹ̀rẹ̀ mú nǹkan lẹ̀ ẹgbọ́n bá nígbà tó bá bẹ̀rẹ̀ mú nǹkan lẹ̀ ṣé wọ́n ní gbogbo Jerusalem kọkùnrin yẹn gan kó máa jà kó máa bínú inú ẹ̀ máa rọ̀ wá ni. We women, we are the owner of our home. The Bible even said it. Only wise ones build their homes with their own hands. Ara wọn kan ta fi ń bí eléyìí wọn kọ́ gbọ́kọ̀ wọn eléyìí ni wọ́n gbọ́kọ̀ nígbà tí wọ́n gan tó ṣe nǹkan tọkọ fẹ́nu lé báwo ni wọ́n ṣe ní gbọ́kọ̀ ẹ̀ side chick ń wọ kí lọ́lọ́ ń wọ̀ wọ́n ń wọ skimpy wọ́n ń wọ kinní kan ìwọ gan ṣèbọn wọ́n ń tà lọ́jà wait in the house for your husband ẹ múra bí side chick ẹ ṣe gbogbo ẹ̀ àwọn ọkùnrin bọ́lá ń ṣe create wọn ni ọkùnrin like to see things so when they see it outside let them come home and kọ́ wá deposit gbogbo ẹ̀ ṣùgbọ́n nǹkan tó bá dábàá tiẹ̀ tí ń lọ lé gan táwọn pé ṣé grandma ẹ̀ta ni mo tiẹ̀ fẹ́ lọ bá ń lé gan pàápàá ẹni tó yẹ kó tó bá máa bá ń lé gan bókò ẹ̀ tiẹ̀ lé gan kó tó délé okó ẹ̀ máa rọ̀ ní tó bá rí because of the way tọkùnrin yẹn ṣe ayé gbogbo pé ẹ̀sùn ni mi ò lè ṣe kinní kan ayé ẹ̀ ti lọ. Ayé yẹn kọ́ la wà ń sìn àrí àwọn tó ń lose home wọn ẹlòmíì ọgbà tọkọ ẹ ní pé irú báyìí mo fẹ́ kó ṣe wà ní bíbélì ẹjọ́ ṣé bíbélì lè fẹ́ ni. Did we get married to the Holy Spirit? Anything your husband wants tí Holy Spirit tó Holy Spirit ló sọ pé kó má ṣe nǹkan yẹn lóòótọ́ that Holy Spirit to convince your husband to be able to accept you like that. Ṣùgbọ́n the moment your husband did not accept you like that, ó mì pé Holy Spirit kan ló sọ fún ẹ. Èmi béèrè question when I was about getting married. Mo sọ fún pastor mi gbà yẹn kẹ́ láyé redeem ayé ìgbà yẹn in the 90s. Tó máa ní ká má wọ yẹtí, ká má ṣe adẹ̀ṣẹ̀ gba Jésù ní táwọn náà máa fẹ́ máa copy. And my husband then were already cutting. My husband said, òun láti kẹ́mi wọ̀ ọ́. Mo bá bèèrè lọ pastor mi, this same thing ni mo pastor. Only are you getting married to the Holy Spirit? The Holy Spirit will not convince you of something and not convince your partner. It will also convince your partner so that everything will work out for good. Mo ti rí èèyàn tẹ́ pé ìgbà tó marry tí ò ṣerun mọ́ tó bẹ̀rẹ̀ sí ní tó sọ̀rọ̀ ẹ̀ di ẹ̀sìn ọ̀sán gan nítorí ẹ̀ lọ́kọ́ ṣe fílẹ̀ tó lọ fẹ́ secretary ní church níbi iṣẹ́. These are the things that people need to learn. We need to learn them. Ẹ má ká má sọ̀rọ̀ àwa darúgbó ọ̀sán gan. Ẹlòmíì á máa bọ́kọ ẹ̀ jáde báyìí aróró àdàbí arúgbó. Láyé tọ́tẹ̀ tí wàá ṣe ìró oríṣiríṣi mọ́ gbogbo ara tó ń fi àwọn àǹkárá dancing. Ara tí wọ́n fi léèsì dancing. Ta ló ṣì ń wọ̀ ọ̀rọ̀ àti bùbá? Kì í ṣe pé mi ò nílò àti bùbá nínú kinní ṣùgbọ́n ta ló ṣì ń wọ̀? Tá bá mọ̀ wọ̀ gan a máa sọ di style ni. People should learn how to spice their homes. Gbogbo àwọn nǹkan ẹ̀kọ́ tí wọ́n ń kọ́ wa yìí, a ní ìdí ẹ̀ nínú ilé wa. A ní ìdí ẹ̀ yé sáfókó ẹ̀yin obìnrin. Wọ́n ní a má máa sá fún.
Ẹ má sáfókó, ẹ má sùn gbalaja.
Ẹ má sùn gbalaja, ẹ ṣe style, ẹ yọ̀dí.
Ẹ jókòó lé, ẹ ṣe jàre.
Ẹ ṣe oríṣiríṣi. Tábà jókòó lé gan tẹ́sẹ̀ bá ròyìn, ẹ yí ẹ tún sọ the another style.
Pause, slow and steady with the news.
Bẹ́ẹ̀ni.
Pause.
Ẹlòmíì
ẹ tún change the style. Ẹ gbé drink sẹ́gbẹ̀ẹ́. Ẹ go for a walk. Ẹ má máa ní òtí
bẹ́ẹ̀ni. Nígbà tó bá ti fi gbogbo ayé wọn mú shift.
Mommy Toya Styles, you ask what if you're genuinely tired? Honestly, if you're genuinely tired, your husband should know.
Yes.
Honest. He should know if you're genuinely tired. If he's a man that is considerate, he will know.
Yes.
But why tí wọ́n ṣe ní mọ̀? That pé ojoojúmọ́ lẹ́ ń sọ I'm tired.
Yes,
so he won't know.
Ṣẹ́ni kì í ṣe pé ojoojúmọ́ ni táyà. Ẹ má fojoojúmọ́ táyà. Kí lẹ̀ ń ṣe tẹ́ táyà? Ṣé ló ń gbé irin ni? Ṣé ló ń gbé irin ni? Ẹ ń gbé irin.
Understand.
Ẹ dúró, ẹ jẹ́ kí n sọ fún yín. Let me tell you something. It's not as if you ẹni sùúrù màmá mi wá. Kì í ṣe pé kò ní rẹ̀yìn. I tell my husband, ọ̀rọ̀ yìí ó dàbí ọ̀rọ̀ sọkúsọ. Sherry, ìgbà míì kì í ṣe pé kò ní rẹ̀yìn. At times my husband will say, okay, ṣé ká ṣe máa níwò. Èmi ò máa lè kẹ́sẹ̀ sókè o. Ẹsẹ̀ tí. It's jokingly. It's not that
èmi máa ń kanra ni o.
Mo lọ fẹ́ gbà wọ́n ẹ ṣe nǹkan tẹ́ ṣe máa gbẹ̀yìn wọlé. Kí ló ṣe yín tẹ̀ ń kanra?
Irú èwo lẹ́yìn nítorí Ọlọ́run.
Kí ló ṣe yín tẹ̀ ń kanra?
Afẹ́mọ́rí ṣe. Ok, ẹ ní sùúrù ẹ mọ̀ nǹkan tó ṣẹlẹ̀.
Ẹ sọ fún wa.
Ẹ mọ̀ nǹkan tó ṣẹlẹ̀.
Kí ló ṣe yín tẹ̀ ń kanra?
Ẹ mọ̀ pé nílùú yìí kò easy pẹ̀lú ọmọ kéékèèké. Èèyàn máa ṣe lọ fi ṣe wàá ṣe wàhálà.
Níbo làwa wà?
At the end of the day, ẹ mọ̀ pé ara yàtọ̀ sára, honestly. Ara yàtọ̀ sára. Ẹ mọ̀ pé mò ń sọ síta sí bóyá màá rí ẹ̀. Mò ń sọ síta sí bóyá màá rí ẹ̀. Màá sọ síta.
Ok, ara àwọn ẹ̀pù táwa ń suggest náà nìyí. Ṣẹ́rẹ́ àwọn ṣe yìí.
Toyos. Sorry.
Ẹ̀pù tí yìí ti pọ̀ jù lọ́yẹ̀ lọ́sọ̀rọ̀.
Mommy Toyos styles.
Yes, sir.
Gbégbó òrùlé ẹ kì í jábọ́ bí mo lọ wo profile yín àti picture yín dáadáa.
Nítorí Ọlọ́run.
Kéèyàn sùn sẹ́gbẹ̀rú yín kó wá máa sọ pé mo ti tired always. Torture ni o. Seriously, it's mental torture. It's not good.
Torture.
Honestly,
mi ò tiẹ̀ wá ṣeré o. Nǹkan tó jẹ́ kí n gòkè wá nìyẹn, honestly. Probably. Mo need the encouragement, honestly. Ẹ mọ̀ nǹkan tó ṣẹlẹ̀ náà. Ṣé mọ̀ pé when you are expected for a long time, ṣóyè yín. Èjì tẹ́ wá fi padà bímọ, ẹ understand, this kò sí ẹbí kò sára, ẹ máa ṣe ilé ẹyin nìkan. Ó ti wá ń bọ́ sí ìkanra. Ọkọ mi ẹ̀nà. Irú yín lẹ máa ń ti ọkùnrin síta máa ní kò rí bí ó yẹ kó understand.
Ẹ ṣáà máa ti ẹni ẹlẹ́ni síta nítorí àwa máa sọ fún yín. Ẹ lọ́ọ́ ti ẹni síta.
Mommy desire ẹ jẹ́ kọ́ express ara o.
Honestly, to be honest, and it wasn't like this before. But Shemo, Arakon Mama, Komi, Shemo, Kekoma, Konra Lodi. And my husband is decided that, oh, hey, she only one because she's sorry, but the only thing I just need time to rest. I understand, baby, address it in to work for Juma Tenny, or Jojumo Pitibawo. Ah, she is so be effect pioneer.
Okay. Mommy tell us that anyway before go on Gami me you got to buy diagnostic. What I will say is for you. No, Sherry, for you, it can be a gradual comeback. You have to start from somewhere. You start gradually. You can make it from do much of have some time. The little time you have, start having much more time to play together. Cuddle, do a lot of caressing. All these things. You can start from there. Get familiar again. By the time you start doing that, you won't know when this thing comes back together. So you have to start from that angle. Then it has to be gradual, not the type that okay every day. Your own is peculiar, so it has to be a gradual step. So start by you have to put a step forward and start it first. So it is sometimes it happens and it's not deliberate. So you have to be intentional about it. Start working towards it. Then start from the angle of do much of talk, cuddle, play together. Then you start getting familiar again. That's what I can say to you, and I know that you will get there eventually.
Eshe Gonsa, we like advise it to you.
Eshe Gon, Prof. Eshe
Gonsa, thank you, sir.
Mr. Toyosi, àwọn níkẹ́ kú sábẹ́ oko. Níkẹ́ kú síbẹ̀ ẹ̀dẹ̀ ní kú lórúkọ Jésù. Ẹ̀yin tẹ́ ṣẹ́bi sílẹ̀ máa jẹ́. Lágbára Jésù, a máa fi tọ́mọ ni, a máa fi rán àwọn ọmọ lọ lóyìnbó. Àwọn àti wà ń lóyìnbó rẹ̀, àwọn ọmọ máa fi ṣe rere lójú ẹ̀mí wa ni. Ṣé you understand? Yes, ma. We can only encourage you, not as if we don't get tired, not as if you won't be tired. Of course, you'll be tired. Téèyàn bá ń ṣiṣẹ́, kò séèyàn tó wà nílùú òyìnbó tó máa ní pé òun ò ṣiṣẹ́. Mo rí àwọn over 60 gan tó ṣì ń ṣiṣẹ́ níbi tí mo ti ń ṣiṣẹ́. You understand? But at the same time, just like the prof ṣe sọ, ọkùnrin tún ni àwọn, and he knows better. I'm sure he's speaking for all other men. You understand? So, ẹ má jẹ́ kó jẹ́ all the time. Àwa náà máa ń sọ pé a máa ń kọ̀ kì í ṣe pé èèyàn ò ní kọ̀ once in a while. A máa ń kọ̀ ìgbà tí ò ń ṣe pé oúnjẹ kò ń ṣe ìgbà tí ò ń ṣe bàbí spicy noodles ta máa ní pé a fẹ́ máa jẹ lójoojúmọ́. No. But at the same time, we should not let it be like every time you are tired, ó máa ń turn ọkùnrin off. Because by the time you tell him you are tired today, you are tired tomorrow, Shemo, and when you teach him when you teach him to be able to be by himself, pé tí má kò fi lọ sí ọmọ alóhùn táyà, tó bá dẹ̀ fi máa sọ síta, àwọn ọkùnrin máa sọ wípé tíyàwó ẹ bá ń táyà, ìwọ náà dẹ̀ wá kàn sẹ́gbẹ̀ẹ́ pé ó ti mọ̀ pé this one is always tired, wàá dẹ̀ máa mú ti bí jẹ. Ara àwọn nǹkan tó máa ń ti ọkùnrin síta nìyẹn. Ọlọ́run akọ gbogbo wa mọ̀ ọ́ ṣe. Just like what he said, you talk more. Gbogbo ìgbà náà kọ́ ni pé wọ́n ń fakóyọ sí yàn. Wọ́n ìgbà náà kọ́ lóyún. Ẹ kàn lè jẹ́ wà lórí bẹ́ẹ̀dì kẹ́ máa rojọ́. No, to be sincere, communication, cuddling and all those things. Ẹ lè jókòó kẹjọ wo fíìmù pọ̀ kan. Kẹ́kọ̀ọ́ just be the baby girl.
Èmi like cuddling. Àmọ́ tó bá ti ń kọjá kọ́ọ̀nì yẹn tó bá ti ń di pé a fẹ́ máa fa kinní kan yọ yẹn. Máa wò pé ó rẹ̀ mí náà tí ẹ ṣì já ṣe sùúrù.
Ẹ pẹ̀lẹ́ Ọlọ́run á fún yín lókun àtagbára ṣẹ́ gbọ́.
It's just that sharing sex is something that is meant to be enjoyed. It's not the way people are talking about sex is, to me, I don't say it that way. It's meant to be enjoyed. Jerry, when cuddling or this thing gets to a point, it's not even the man that will focus your very so. Now you go commodity for yourself because the thing is, it's something you have to train yourself to the extent of where you enjoy it. It's not supposed to be a big deal. It's something you enjoy, and if you get to that level, it brightens your day. When you do this thing early in the morning, by the time you're going out, your day is already brightened. You just be smiling all through the day, and that's how it is. So don't see sex as
I will make effort, but she's also
it's you will get there. Just start from somewhere.
Yes, sir. Sir.
Also, you need to look at what is making you tired. We need to.
It's just tiredness, honestly.
Yes, something is making you tired.
No, because no, the thing is that, sister, like I was going through. I'm going through thyroid, hyperthyroidism. So sometimes she affect hormone. No, she understand. But you
it does. Yeah.
Well, I understand because sometimes it's not that I'm not in the mood sometimes, so most of the time, so. But all of a sudden, I would just feel like, and the endocrinologists have advised that it's normal. It's part of the symptoms. It's normal. She understand.
Yeah.
Thank God, at least gradually, I'm getting over it anyway.
Oh, good, because the reason has to be looked into. Because if the reason is not dealt with, it will always be there. And another thing, Bene, you're right. Our men should help. Honestly, you men try it. See the lights shift and you were the one at home. You prepare meal for her. Me can hoof and let me. I will not lie. All those hard work, my husband does it. And even sometimes when I feel tired and I remember his kindness towards me, I'm not just talking about him helping because he's kind. He's a kind man generally. You would not want to say no, honestly. So he does this. Weekend talk about a little night. I don't do anything. He won't even let me do anything because he will do all those things and he's very hands-on. So our men needs to be hands-on, honestly. I know most men want Jesse and all those things, but help for chicken, do so many things so that especially when they have small ones. Easy. Don't just sit down and say for me and all those things. No, you need to help so that see how you buy this tilekun yen speed tó máa fi lọ tilekun because ó mọ̀ pé okay so okay
let me gift this is
just to add something.
ọ̀rọ̀ yìí máa ń dùn mọ́ yín lẹ́nu bẹ́ẹ̀ ni pé mo ice cream.
Just to add something.
Thank you for the gift.
Share that with that gift, Bo.
Yeah, just to add something for the men. Just this one is for the men. You see, because most of the time men we see sex as penetration, and that's it. You see, sex is not all about penetration. Sometimes just play with your with your babe, cuddle, do a lot of romance, and you don't need to penetrate. I do these things a lot sometimes. You just play and all that, then we go to sleep, we cuddle, we sleep. It's not about penetration always. You don't always have to penetrate and come out and then put it on here. That's not always
selfish.
sex.
Even when you penetrate, don't be selfish. Let's ensure your partner enjoy you. Make sure they enjoy you. And Nigerian men, learn to help. Honestly, it's the kindness that you give in your relationship, in your marriage. It goes a long way. Chetiri, it goes a long way. And for men, Tombati Damira is the easiest way for them to release. And sometimes your women are denying you because that's the only way to bring if you move. I would deny you sex. But when you do right by your woman, she won't deny you. Ṣé tó bá ṣe ń bọ́ tanu bathroom sẹ́, tí ìyàwó yín rí kíní yẹn tó dúró, ó wá kọ́kọ́ fi ṣeré ká, èmi ni mo ní kíní. Tán fi kíní yẹn ṣeré, tán fi ẹpọ̀n méjèèjì ṣeré tán pé ṣó wà ń bẹ̀, jẹ́ kí n wò bóyá ó sì dúró dáadáa. You know, you play with yourself. I can't imagine having a partner I can't make joke with. Jẹ́ kí n wò ó ṣe ẹ̀pọ̀n yẹn sì dúró jẹ́ bókó ẹ̀ wá jẹ́ ká wo kó jẹ́ ká, you know. So all those things play with each other. Even if you're watching TV, sit beside each other, hold each other hands, you know. Go for a walk in the evening, especially even Tabani baby, put one in the buggy, go for a walk, even if it's 5-10 minutes, have that fresh air together. You can even sit beside each other, just holding hands and not communicate and not just talk, but you are in sync. Your body is talking to each other, you know. Sometimes your husband might be stressed from work, you know. You can give him massage as well. Don't give a massage, you know. Give him massage. You know if he's had a hard day, if he's had a hard day, you will know. Just ease. Like, it's for us to ease each other, you know. Life is very stressful. Sometimes, especially for people that have small kids, it doesn't have to. In as much the house is not physically dirty, toys can be.
Thank you for having me tonight. Prof, advice thank you so much. Thank you. God bless you. Thank you. Sir. Yes, sir.
Thank you, gifters. Thanks so much. So yeah.
Ọkùnrin wa gbogbo yín kọ́ lè máa dàbí Yọ̀mí o. Tó wọ́n mọ̀ wọ́n ní hòtẹ́ẹ̀lì tó ti sáré bọ́ pátá o. Ẹ má máa sáré bọ́ pátá. Tọ́ba ọ̀gẹ̀ ẹlòmíje ó ti sáré yọ kó síta.
Tẹ́tí sọ kò lu Yọ̀mí báyìí, ó mà ga o.
A máa sọ kó pa Yọ̀mí ní last night.
Kò tí ì tilẹ̀kùn hòtẹ́ẹ̀lì, ó ti sáré bọ́ pátá olóògùn.
Ẹ lè imagine.
Ó ti yọ kó sọmọ lọ́mọ.
Bẹ̀nẹ̀ ní sẹ́, Bẹ̀nẹ̀ o gbọ́dọ̀ dàmíra lónìí, at least you are not going to work tonight. Ẹsẹ̀ yẹn máa gbọ̀n. Tẹ́mi, má máa jágbe mọ́ kú wa o.
I gbọ́dọ̀ put it into practice.
Mo jẹ́rìí, àwọn èèyàn ti ń dàmíra already. Sister Tẹ́mi, do not shout on my brother tonight. It is not allowed. Mama ní kíní kan. Tálẹ̀ ti gbọ́ rí tó kú sábẹ́ oko. Anybody, gbé statistics yẹn jáde.
Ẹ bá wa sọ fún wọn.
Tán sọ pé cause of ikú oko ló pa o.
The funniest thing ni pé ìwọ tó bá rò pé o máa kú sórí sábẹ́ oko, ìwọ dẹ̀ máa bọ́ sókè, má lọ sábẹ́.
Ẹ ṣe jẹ́ ẹ̀gbọ́n. Wọ́n jókòó sókè, jókòó léṣu.
Àbí wọ́n ní kó be the rider.
Be the rider. Èwo ni kíní? Babies of course, statistics pé yàn kú sábẹ́ oko.
Bẹ́ẹ̀ni,
you know when
we are not avoiding you. Bẹ́ẹ̀ni, Mayor is not going to avoid you. Come back here.
Bẹ́ẹ̀ni, come back here. Mo trust the brother mi. Mo trust wọn sọ pé ọpẹ́ o.
Alẹ́ Friday.
Okay, ọpẹ́ o lónìí Friday. Kò sí iṣẹ́ lónìí. Kò no shift. Tó ṣe lótìtì. Kí ni owó kílẹ̀ ń wá? Gbogbo ìta ti ṣe ń kọ́.
Ta lówó sọnù lọ́wọ́ ẹ̀?
Owó kílẹ̀ ń wá, gbogbo ìta ti ṣe ń kọ́. Ṣé ètò fẹ́ ṣe ní wíkẹ̀ndì ló fẹ́ sọ̀rọ̀ dèmi lọ ní àná?
Ẹ máa bá mi bèrè lọ́wọ́ wọn.
Enjoy ara yín. Friday olóyin ni o.
Ìwọ tó bá wà, ẹjọ́ Mayor, ìwọ tó bá wà lórí kíní tó wà ní Ontario àbí tó wà ní Canada pẹ̀lú bí snow ṣe ń dàbí ẹni fẹ́ dákú yìí, tó bá mú shift, ẹ má jẹ́ ká bẹ̀rẹ̀ sí ní rán nǹkan síra wa o. Gbogbo yín ẹ wà nílé yín.
Ẹ wà nílé ẹjọ́ pẹpẹ sùn.
Bóyá kẹwà lábẹ́ oko ni àbí kẹ dúró sábẹ́ oko tẹ́ bá ti fẹ́ mú bẹ́ẹ̀ ni.
Ẹnìkan ẹ̀tàn tún fún ọmọ, ẹnìkan lọ ṣeré, kí ló dé?
Ẹ jẹ́ káwọn ọmọ lọ ṣeré, ká lọ máa wo cartoon.
Ẹ wọ kábà, so that tó bá ṣí sókè, ó máa ní ìsìnkìní, ẹ má wọ pátá o.
Bẹ́ẹ̀ ni.
Ẹ má wọ pátá ayé 70 o, ẹ wọ G-string. Ẹ má wọ pátá rárá.
Ọmọ àti ẹ̀wọ̀ pátá rárá ló máa bẹ́ẹ̀ ta o.
Ẹ wọ pátá rárá, easy access.
Easy access ni.
Ẹ lo nice
spray. Àbúrò máa wọ pátá ni ká ṣe tó máa fa jeans, ká máa fa kíní.
This plastic, only weekend wo ni.
kò sí ṣé oko dídó wá wà holy ni.
Ta ló sọ pé àwọn wò tí ni àwọn wo ló ní only Friday yẹn gangan ni òun gangan ni holiness yẹn la fẹ́ gbé wọ la máa fi mú dádì mọ́ra làwọn ọkùnrin láti máa fà wá mọ́ra bẹ́ẹ̀ ni.
ẹ má ṣeré kéré o holy kìíní kan ṣé oko dídó wá jẹ́ òun holy.
aṣana làwa o aṣana ọlọ́mọ.
abẹ́ ni o.
aṣana tó ń rán ọmọ lọ táwọn ọmọ ń ṣoríire lójú ẹ̀mí wọn táwọn ọmọ ń kàwé tó ń gboyè.
mọ̀mí Yínká Olúṣèyí píríọ̀dù máa tán ṣé ẹ fẹ́ kí gbogbo wíìkì ṣe píríọ̀dù ni.
àwọn wo ni.
wọ́n ní àwọn wà on period ṣé ẹ fẹ́ kí gbogbo wíìkì ṣe píríọ̀dù ni píríọ̀dù àtọ̀ mi ló ṣe bẹ́ẹ̀ ni àdẹ̀mọ́ wa.
ẹ get ministration on Sunday ṣé pásítọ̀ yé òǹdóbò ni.
kò yé mi o ṣé pásítọ̀ yín gan ti dá mi ẹ notice njọ Sunday pé pásítọ̀ yín máa smile ni.
tí pásítọ̀ bá smile tó bá ti mú kanra dání ẹ mọ̀ pé ìyàwó òfin ṣe nìyẹn.
ìgbà ló máa kanra la máa preach your wife be submissive but ọjọ́ tí wọ́n bá change the preaching. ẹ bá wa bá wa táàpù o.
ẹ má jẹ́ kí o sì dà wá nù.
ẹ tap.
bẹ́ẹ̀ ni sexual therapy ni therapy session bẹ́ẹ̀ ni in fact
honestly aside the physical benefits, the hormonal benefits, the spiritual benefit is there as well. It gets to your husband, you know. So Emma, we're close. Emma, you know, you can talk about things. You can be free with each other, you know. You can be free, you can talk about things. And for the women and the men, it's when you teba damira, it's release that happy hormone, you know. Your brain will trigger you to release the happy hormone. You know, Emma, we're okay. That's the honestly.
Mayor,
I just
Emma. àwọn yẹn tó bá ti máa ṣe lẹ ẹ̀rọ pógùn ní kinní yẹn náà wà medicinal.
Oh yeah, it is.
Wọ́n máa sùn ní tẹ́kára wọ́n máa balẹ̀. Kára wọ́n máa balẹ̀, wọ́n á sùn. Wọ́n á sùn dáadáa, wọ́n gan kọ́ lọ tọ̀wò, wọ́n máa rí pé rere lolúwa.
Bẹ́ẹ̀ ni o, ẹ dán eléyìí wò, ẹ rí pé rere ni olúwa. You feel relaxed. Ẹ lo vitamins, you know. Well, look after your health, look after your physical health, your mental health, all these things, you know. Life is stressful, honestly. So anyway, tabati feel help parawa to ease the stress of life. We have to do it. We have to do it. Mo de koniki kan sáré wá sọ̀rọ̀ fún 30 minutes yo. Ló ti Oga. Trust me, UK. After 2 years, but more job.
Thank you, Mayor. Thank you so much. That wisdom God has given to you. To be, you know, this is àwọn kan yìí nǹkan tẹ́lẹ̀ omi tó máa táwọn churches mi máa ń sanwó fún ni tó máa gbé minister wá tó máa mówó gidi lẹ̀ nǹkan táwọn míì fi ń kọ́ àwọn obìnrin jọ tó máa fi ṣe seminar fún wọn ni. And we are getting it on platter of gold. God bless you so much.
Amen.
Gbogbo alórúkọ Jésù Ọlọ́run àfi wá lọ́kàn balẹ̀ àwọn ọmọ wa rere wọ́n máa ṣojú ẹ̀mí wa ọ̀ lágbára Jésù àwa la ṣe sí àwa náà la máa jẹ́ àwọn ọkùnrin wa gbogbo a máa jèrè ara wa àwọn ọkùnrin á jèrè ìyàwó àwa náà á jèrè àwọn ọmọ wa lórúkọ Jésù wọn ò dẹ̀ ní fi òkú ẹnì kankan nú wa ránṣẹ́ sílé o lágbára ìjẹ Jésù ẹsẹ̀ wa la fi rìn wá sílùú àwọn ìlú òyìnbó yìí a bá lọ́lé alọ́ṣẹ́ ayọ̀ ni. Lágbára Jésù wọn ò ní fi àìsàn gbẹ́nì kankan nù wa lọ sílé lágbára Jésù gbogbo nǹkan reason tí gbogbo wa dẹ̀ fi wá síbí ni pé ìjà ìyàwó ọmọ tí wọ́n fẹ́ fìyà jẹ ni lágbára Jésù àwọn ọmọ wa ò ní rálágbèdá o wọn ò ní rógun elénìní àwọn elénìní tí wọ́n ta ti torí ẹ̀ kọjú ìjà sí wọn tọ́lọ́run lò wá láti lè gba ọmọ yẹn sílẹ̀ yìí lágbára Jésù àwọn ọmọ wa wọn ò ní fojú kan rú ẹ̀ o ọmọ wa lọ́kùnrin lóbìnrin wọn ò ní rógun elénìní o Ọlọ́run á fi gbogbo wa lọ́kàn balẹ̀. Ẹ ṣé gan ni. God bless you.
Ẹ ṣé gan ma.
God bless you
Thanks
so much.
Yeah,
Thank you.
Everyone.
Prof, ẹ̀yin náà ẹ ṣé o. Tẹ́ dúró fáwọn ọkùnrin wa. Gbogbo nǹkan tẹ́ kọ́ wọn. Mo sure fáwọn náà ti gbọ́. Thank you so much. Gbogbo ẹ̀yin tẹ̀dẹ̀ fẹ́ sá lọ. Ẹ má sá lọ bẹ́ẹ̀.
Ẹ sá lọ bẹ́ẹ̀.
Ẹ ṣé gan. Thank you so much.
Gbẹ́dẹ̀ fún brọ́dà mi o.
Ẹ má reduce the volume o. Ẹ má reduce the volume. Ẹ jẹ́ kí dájú wa gbọ́. Ẹ jẹ́ kó gbọ́.